You're live.
Good afternoon, folks. This is the, what day is it? It's the August 1st day.
September 1st.
September 1st.
September.
Oh, Lord, I lost a whole month. September 1st. Afternoon meeting of the House Appropriations Committee. At 1:30, we're going to continue our discussion of the stimulus bill, but we have about 10 minutes now that we can try to find additional items on the budget that we can tick off. And I understand you have something, Peter.
I do, other than the ghost just closed my front door, but whatever. So I've been in, and this is not in the budget yet, but I'm going to be recommending CRF funds for it. I've texted Kitty. So the recovery centers, the 12 recovery centers that are around the state, I think most of them are called Turning Point. I've never asked that question. Have spent money in cleaning and in social distancing effects so that they can continue to do their work with folks who are in recovery. They have spent between $3,000 and $5,000 per center. They are scrambling to get me exact dollars. I don't think that we'll have it in a timely enough manner. So my proposal is going to be that we allot $4,000 per center times 12, $48,000 of coronavirus relief funds to the cleanup slash social distancing efforts that they have already done to ensure that they can continue to operate pending, and that will be paid to them pending the receipt by ADAP of receipts that show that they've actually spent these funds.
And you're working on language on that, Peter?
You've just heard me out loud, and I'm going to put something together that's not literally, I got off the phone 5 minutes ago with that, and I'm going to put together language that will essentially say that.
Didn't they qualify for the first round?
They didn't put in for anything. They have not put in for anything. This is the first that I've talked about them in regards to CRF funding.
So
Why didn't they put in for it?
Bob, I don't know. Some have applied for the paycheck protection plan. Some have put in for healthcare stabilization funding. I have encouraged all to put in for healthcare stabilization funding. It's a loose conglomeration of centers. In other words, they're not all one center, but they are operating under the same type structure with the same, hopefully with the same effect around the state to benefit patients who do not want drug-assisted treatment for their addiction that they are trying to overcome. So it's when I reach out to them, I'm talking to a director who sits in a meeting with all the directors. And so that's what's going on right now. I've, again, told them that exactly what's in this budget. They're level funded. They will not receive any one-time funds from us, but they all, I believe, fall under the healthcare stabilization grant capable piece, and they should all apply for it. So they have been told that, and they are hopefully getting on it. That is not something that this committee would address, but the CRF piece for expenses that they have incurred, that is something we would address.
Okay. Do folks have any questions for Peter on this?
So,
I'm not seeing anybody. Diane?
Diane.
thank you. I'm not reaching my buttons fast enough. I just was recalling, and sometimes I recall what the House did, and not
Sure.
so much
Yep.
the Senate did. I'm looking at the H965 that we did in the summer for, it's underneath the family supports. I don't know if that, you've got here vulnerable population, and in the notes, there was 350,000 recovery, and I don't think it was long enough. I don't know if that was a part of what maybe they had some access to.
They have, so yes, I said 48,000, whoever is texting me, 4,000 times 12. And that was not them. I don't know who that was, but that was not them.
Okay.
They are in the budget, level funded for $240,000. We did not include one-time funding, but they do have access to funds as I've explained, the healthcare stabilization grants, and all they have to do is apply, and they've been told that a couple times, and some did apply for the paycheck protection, and now this. So that's it.
I've got other ones that I'm not too sure where they'll
Let's
be.
finish this up.
Yep.
So any other questions on this for Peter? The question I would have, Peter, is if they have access to the healthcare stabilization grants, why would we make a specific allocation for them?
So they have not yet applied for it, and I don't know what the outcome will be for that. I cannot control that side. The only thing I have input into is this side. Can't control this side either, but I can control what I recommend.
Yeah.
So hence, that's the reason why I'm going to recommend. And I always look at the stabilization grants as something to ensure that because of operations and the way that funds used to come in and no longer come in, that they can continue to do the job that we have asked them to do. Whereas the CRF funds that I'm proposing is because they have done cleaning supplies and clear glass and things like that to keep social distancing. So in my mind, it's two different things. The healthcare stabilization is not meant necessarily for a repayment of expenses incurred.
Okay, and so I think we're trying to get Kitty in. She's here. I'm handing it to her so I can take this phone call. We were talking about potential other CRF spending, Kitty.
Oh, okay. If there are any, though it wouldn't be done just in our committee alone, make sure that the initial discussion is out in the committee's jurisdiction.
And Kitty, because we had 10 minutes to spend, I just went over what I texted you about 8 or 10 minutes ago. So yes, I will talk to the committee of the two committees that I go to in regards to this.
Yeah, and who would that, okay, that would be Ann Pugh probably. I don't
Correct.
know where yours.
Correct.
Okay.
And I also go to Chip Troiano as well.
Okay, I was just gonna check and see, I had these all listed, for.
Now I need to put together an email and I will send it along to several people.
I'm looking to see where yours goes. So we're just, in 2 minutes, we have Susanna joining us to work on that bill, but I'm just looking to see where I dropped your request, Peter, and I don't think it was in with, no, that would be the wrong committee. I'll look for it, Peter. Make sure that I follow up with you on that.
I will email you.
Okay, thank you. It wasn't in Tom Stevens' committee and it wouldn't be there, right?
No, this is, Kitty, I just got off the phone late over the lunch hour with the network. And that is the information that I got from them.
Okay.
So I texted you first, talked to our committee. Now I need to email the individuals in the house that I work for.
Yeah. Recovery centers are through ADAP, a health department.
That's because
That's
I didn't
correct.
assign you anywhere. I didn't assign you anywhere. So, okay. So they need to go to ADAP, so they would go to Ann Pugh, right?
Yep.
Okay, I'm just looking to see what else she has. Shoot, okay. Can I just send it, Teresa? So do we have Susanna yet?
Haven't seen her.
Should
Okay,
be here momentarily.
And then, Peter, tell me that amount again, 48,000?
48,000. It's 4,000 per center times 12 centers.
Oh, it's getting warmer. I can take
Nothing but magazines.
permission to take my jacket off.
Really? Any good ones?
My husband heard me. He said denied.
Okay, so do we all have I don't have a bill. This no printer thing is killing me, Teresa.
Ink, right? You just need an ink cartridge, not the. or-
Yes, and my husband took a picture of it so that he can bring it home, but he's not coming home till tomorrow.
Is she asking me to drive her to one? Drive her one?
It all printed, it prints whenever it wants to. Yay, there it is, no. Yeah, I got a bunch of stuff here. Wow, it just prints when it feels like it, but now I don't have his computer, so, okay.
Kitty, do you want to text Susanna? Find out where she is?
Yep. Peter?
Yes,
We will do, I didn't send out the recovery centers to anyone, and so we're going to do it in our committee. You can bring the request when we do all the other CRF. So
Okay.
we'll just do it in our committee.
do you want me to send it to Ann Pugh?
Nope,
Okay,
we're going to do it because all of those have gone out and I don't want to confuse people now.
that's fine.
Chip, which we
It's
need
pretty
to-
basic.
Let's see. Does she know she's coming? 1:30?
Yeah, she confirmed it. Maybe she got tied up.
That's such an awful term. Are you tied up? I'm sure we shouldn't be using that one. So while we're waiting for her to come, I am working on some language, and Mary, this is within yours, so you need to catch up with me. I'm working on some language that I mentioned about the intent of our committee, and I'm going back to listen to some of our testimony. The intent of our committee by doing the Pay Act for 1 year and being silent on the second year. And so Mary, if we could catch up after this or sometime tonight, because I think on the floor, I'm willing to field questions, but is that within, you have human resources, right?
Yeah, so I guess it's mine. It was mine last month or 2 months ago.
Okay,
Okay, thanks.
our intent was pretty clear. Marty, you have your hand up? You have your,
I was just gonna say, that wasn't a discussion in our committee. Our committee, we passed it for the 2 years. It was the Senate that pulled it out.
no, we never took a vote on it.
Well,
Took a vote for on the 2 years. We were just about to take a vote and then we broke for lunch and then there was a bunch of conversation and then it didn't move and ultimately the only vote we took on the Pay Act, I'm pretty sure, was to fund the first year and be silent on the second year until we understood our fiscal landscape. Pretty sure.
Okay, I don't recall it that way. I recall that when we discussed the Pay Act and we decided, or it was decided to put it in the budget,
right.
it included both years in the House version of the budget that went to the Senate.
And then
And the Senate modified it
yeah, the Senate pulled
in the
it
budget.
in the budget.
Oh, no, we didn't do it for
Right.
2 years, I don't
So it
think.
wasn't
Yes, we did, Kitty.
in the original one, yes.
Are you sure?
Yep, Senate pulled it out. I'm paused.
Oh.
That's funny, because I remember it the way Kitty does.
No, I don't. We never took a vote on 2 years in the House. We did not take a vote on it. I'm sure of that. We were about to take a vote and we stopped at noon and there was a lot of discussions that I didn't know were happening that turned up at noon and we did not take a vote.
Oh, I have just,
Are you talking about? Yeah. I mean, maybe Kitty, you're referring to when the Senate changed the budget, they amended it by removing 1 year of the Pay Act. Obviously, that should have come back to us to decide if we wanted to concur with their changes or not. And maybe you're referring to a discussion then. I don't recall that discussion at all. Matter of fact, I was surprised to learn recently that it was only 1 year. But we can double check our records. At any rate, that's the way it passed with only
Yeah.
1 year.
Sometimes I'm getting the where we were in March blurred up with where we were in June. And
So
I'll-
let's check the
We
record,
didn't act on it until June.
because I have a very clear memory with Marty, and Chip and Kitty have a clear, so we can check the records rather than debate it here.
we're just waiting for our witness.
Yeah, she's gonna, 1 minute, she said. She just texted.
Yeah.
So the language that we were waiting for from the Education Committee, they won't have it today. They hope to have it late tomorrow.
What's it on, Chip?
Well, to be honest, I'm not sure of the
No.
full scope, but it at least in part has to do with the length of days, the number of days that schools have. But it sounded, I was talking about that as I was rushing out to get back for this, and it sounded like there might be more in it than that,
Okay.
but at least that.
And Chip, was there any discussion or resolution around the national membership money being changed to staffing the actual board?
Yeah, there was that's the discussion that I heard that I was in there for. The committee hasn't come to a decision yet. But I guess if we have 30 seconds, I learned some stuff so that the Board of Ed had dropped that membership in the previous year because they were looking for to free up money for legal counsel. There's not a budget item in their budget for that, and they were not getting that support from the Agency of Ed. So they felt they needed to create the capacity for providing their own legal counsel. So the reduction of the dues had happened previously to this year. And they used that legal counsel and believe they still need to have the capacity to use outside legal counsel. The board chair has put forth a proposal that reduces their budget by, I think it's 12.5% from what was in the governor's January proposal, because he identified a couple of areas that he thought they could, knowing that they are feeling that they wanted to step up in the way other agencies and departments have been asked to cut their budget. They identified areas that amount to about $10,000 that they felt like for this year alone, they could weather those kinds of cuts. So the proposal he's put to the committee is to reduce their budget from the governor's original proposal by 12.5%. And the committee is going to give us their final decision, but not till tomorrow.
Can I ask a follow-up question? Was that membership with, do you know the name of the organization?
VASBE.
Okay,
That's
Okay.
the-
Okay.
State Boards of Ed.
okay.
Hey, Susanna's here, so I think we better get started.
Yeah.
Sorry, Chip and Kimberly, I hope mid-sentence. Susanna, welcome. And so, Mary, I was late coming on. You've already set us up with live on YouTube, and we're going to continue our discussion on the stimulus equity bill, Susanna. And our committee has some questions that we need to work through in order to get this bill done and move it. We talked about the definition of residence, and we'd like to know if that, what problems that creates with any of the individuals involved, or if definition, that we need to be as clear as possible with a definition, and, if the one in the language work, or if it needs to be tweaked, or if, we work from the driver's privilege card. And we wanted to talk about the timing and how fast you think that we could get this set up, and getting the money out, and the length of time in reality that people would need to fill out the application, to come forward and fill out the applications. And so we want to talk about deadlines a bit. And then there's some other places in language about your involvement in the procedure, in the process, if we should use a may or a shall with the agency, with your involvement and with other groups involved. So now I've just scattered the language everywhere. So if Teresa, if we could bring up the language, I think that would help us move through in sections at a time. And I know that you had worked on language, and if you could share some of your concerns with things that we're thinking and help guide us, that would be helpful. So let's move down to section 1, definitions. So we've talked to Mike O'Grady, and I think committee, we were all set with these definitions, or was there something within these definitions that we wanted to run by Susanna that Mike was not able to? He's going to add some language in the eligible adult that goes back to the original definition for the $1,200 payment. Maida, do you have a question?
Yes. Did we have questions about the definition with regard to eligible child, that the year issue? Was that something we had settled already, or was?
No, we did not. And Susanna, the problem there is the federal, in the federal law, they have under the age of 17. And so we're waiting to find out if it meant 17-year-olds were treated as adults, or if 17-year-olds just happened to be left out. Do you happen to have any, was that anything that came to your attention ever?
It wasn't actually. I wasn't aware of that oversight. And I imagine, if I had to speculate, and it's so hard to speculate on what Congress means when it says something, but I would imagine they might have meant 17 and under.
Right, and I asked that, and Mike said no, it was
Under 17.
Under 17. So I asked, and I said, does it include 17-year-olds? And he said no. So that's something that we will tease out, and if you keep that on your radar. Anything else in the eligible adult or child that we'd like to run by Susanna? Mike was going to cite a piece of the federal law in number 2. Number 3, we'll get clarification on the age. Marty?
Dave Iacovone brought up the question of, did the child need to be with an,
Yes.
the eligible adult had to be a parent? What if the child was here with an uncle or an aunt, as an example, not actually their parent? And our question, I think, was how common might that be? And I don't know if Susanna has any indication of that or not, or whether we're just better off to leave it the child and a parent.
Would you like to weigh in on that, Susanna, on number?
Yeah, I would say being as inclusive as possible to make sure that we're serving as many children as needed would be ideal. So including language that allows for guardianship, and understanding that there are some family structures that maybe guardianship is not as clearly defined in legal terms. But if there's an adult who is effectively the caregiver or the guardian for a child who's in Vermont, and they were excluded from receiving such payment, then I think that just as a matter of equitable policy, it would make sense to shape the language in a way that's inclusive of that child. So I wouldn't limit it only to parents.
So how would, if we have parent or legal guardian, do you have access to our screen? Are you able to see our screen? That is,
Yes.
what would you recommend that we include there? What would a recommendation be?
I would say for whom an eligible adult is a parent or legal guardian, and this is just off the top of my head, and I have not run this past any of our other attorneys yet. So just me spitballing, but we might consider if there's a situation where a child has a guardian and it may not be formally, for whatever reason, it may not be formally final in the law, but they can demonstrate that that child does have a guardian here in Vermont, then maybe on a case-by-case basis, there could be an opportunity for the state to review any supporting documentation they have and include that situation. I hope I've explained that cohesively.
I understand where you're going, and so you need time to develop some language there. And Chip, will you
I'll check in with Mike.
excuse me?
Yeah, I have a note to myself to ask Mike if there's a way to do this to cover what Susanna is talking about
Okay.
in language.
So the committee is good with that section, and Chip will work on that.
Question.
Yes, I can't see you, Mary, because I have this. Go ahead, Mary.
So under eligible adult, it says that they're eligible due to their immigration status. There are people who did not receive a payment, not because of their immigration status, but because they are married to somebody who whose immigration status prevented them from receiving the benefit. So I wonder if we need to expand that language to make sure that we pick up those other groups of people who are excluded.
Mary, I think Mike commented on that. It's not due to their, it's just due to immigration status. And he said that should bring in the other groups, I thought, because it was due to immigration status that me maybe as a legal citizen and my husband isn't, due to immigration status, I wasn't able to get it, but it doesn't say it has to be mine. Did anyone else hear Mike say that, or did I just assume he was? Does anyone?
No, I
That's
heard that
exactly
too,
right.
but this was
Yes.
just about the child though, not the.
No, I'm on adults now.
No.
We're on adults.
Right.
The language that I've been using when discussing this is due to their or someone else's immigration status.
And I think Mike said he took those words out because he thought this made it cleaner, but we can go back to that and see.
I'm
That
just,
was Mike's explanation.
my concern is that a plain reading of this leaves it open to interpretation.
Mhm.
And if one wanted to be limiting in one's interpretation, you would not include those other groups of people. So
Okay, so Chip, we have that to bring to Mike, and he can add it, or if he needs to come back and explain, if I can't remember exactly, but he said that he did this way for a reason, but we want to make sure it's not limiting. Okay, I think I can't see hands so and have both up. I don't have hands that I can see, so let's move on to the next section. And,
Madam Chair, if I may, I do have a little bit more clarity on the question of 17-year-olds.
Oh, okay, great.
So evidently, under the CARES Act, 17-year-olds were not eligible for the $500 augment for children. In fact, I believe no dependent over the age of 17 would qualify a person for the $500 augment.
Were they eligible for the 1,200?
I think if you were a tax, that is unclear still to me. I don't even want to pretend to have an answer. I don't, but I do know that 17 was the cutoff for the child amount. And when we were figuring our estimates of the Vermont population of eligible children, we took children, I believe, to be people under 18. So including 17 and 18-year-olds in Vermont would not add, to my knowledge, would not add anything to the estimates we've already had.
Okay, and the language before us has under 18 years of age. And Diane, you have a question on this?
I was just thinking, you know, if, I think they probably in the federal law, it was like, if you were 21 years old and you're still being, you're a dependent in that family, you didn't get the $500. But if you were 15 and a dependent, they got the $500.
But if you were 17 and a dependent, you did not get it.
Correct.
Right, or 18 or 21.
Right, but 17-year-olds, you're not legally an adult. There's really a difference between a 17 and 18-year-old.
Not to drag it out, but I don't know even if you're 21 and you're a dependent or being claimed as a dependent, you couldn't get the 1,200 alone either. You got nothing.
No, I think anyone who was claimed as a dependent, if that person was eligible for CARES Act funding, then it was received by the person who claimed that person as a dependent on the tax filing.
Okay. All right.
Okay, so since we're going to come back to number 3 for our first decision, unless you think we can clean it up right now, can we agree to under 18 years old, that 17 and under, or do we have is this going to be a long discussion? Because I want to be sympathetic of Susanna's time spending with our committee.
Well, we were going to hear back from Mike on this issue specifically, and maybe we should wait until he comes back with that information.
Yes.
17, 18-year-old. Okay. Okay, let's, next question.
Did you call me?
Yep, your hand was up.
Okay, I really like what it says right now, under 18 years. So if you're 17 years old and 11 and a half months, you can still get the money. Once you hit that 18, then you're not eligible. And I really like that. So that's just my opinion on the.
Okay, thank you, Linda. I think we'll wait. There was a piece that Mike was going to come back for clarification, and then we'll just take a position as a committee, whether we leave it to match the federal or whether we move it to under 18 years of age.
Okay.
Okay.
Thank you.
And now we went down through number 4, and Mike spent quite a bit of time on the personally identifiable information, and that this was to outline what types of information would be protected. Are you okay? Susanna, would you like to weigh in on any of these pieces, or do you feel that number 4 is okay? I know that we had spent some time on concerns of what information might be made public.
Yeah, if I could just get a quick scroll through, I can just.
So it starts with name, and Teresa, down on page 2, please. Here we go. And it goes to, here we go. That these would be protected. We can go up some more because just name is on number 1, Teresa. And it goes down to letter I, or singularly or alone, any of that information.
I think this is consistent with the first draft. It doesn't look like anything's different. So I would say that this would be great.
And then we move to number 5, which is resident of Vermont. And Teresa, will you move it up so we can have all of the resident of Vermont on the screen? Thank you. Were there questions here for committee members regarding resident of Vermont that we'd like to run by Susanna? Or Susanna, do you have any concerns you'd like to share with our committee?
I don't.
Was it? Go ahead.
I was just going to say I reviewed it and I am comfortable with this language.
Any questions for Susanna? Bob?
Yeah.
And Mary?
Yes. I just read this quickly. Where did it was at? it went on to say, intends, a resident of Vermont means any individual living in Vermont who intends to make the state his or her principal place of domicile, either permanently or for an indefinite number of years. So what does that mean? Intends maybe for permanently and maybe not. I don't get that. And I'm not saying we need to change it. I don't think it's that important, but it's not. I don't think it's well. I don't think it's well written.
The question was, if you keep going, it's those workers who are living here and have been here for quite some period of time. The individuals that would not be included in this bill, and we talked about the H-2A and students and people that are just on a contract that have sent over to work for a company, not be included in this language. And so do we need to do any more to clarify?
I chased this down really quick because I got the feeling we were leaving it, and I haven't even had a chance to really totally read it and digest it. It's not bad, so I'm gonna ask to move on. I'm not gonna hold everything up over this.
But I think it's important that we all come to a common agreement on what a resident of Vermont is. And so we have clearly stated which group would not be included, but do we have enough clarity on those who are? So I have Marty and then Diane.
Well, I'm just reflecting on Mike's comment that this is a standard definition that was developed when we were talking about driver's privilege cards for persons who were here, not necessarily properly documented as far as the US government is concerned. And I think that's the same group of people that we're talking about now for this economic stimulus program. And that's the definition that's in statute now to refer to that group of people so that they can get driver's privilege cards. And I would think that would be the very same group that we are talking about for this.
With the
So I
inclusion,
like using a legal definition that's already in place.
So we have Diane and Mary. Bob, did you want to comment on that? Thank you for that clarification, Marty. I did not remember that it was the definition for the driver's privilege card, but I did write down that some committee members mentioned to keep the definition as clear as possible. And if it's already in statute and it's working for the driver's privilege card, it's something for us to consider. Diane?
That was exactly what I was going to say. Marty and I were on the same page, on the same note, that this is already, and sometimes, and I'll be the one to issue the warning that you said, if we start messing with already law policy, we might need to involve other committees or things. But Marty's right. That's my notes too. It's based on the driver privilege. So that definition already exists. We're not creating it.
Thank you, Diane. Mary?
I don't need to say it again for the third time. Everybody's covered it. I'm uncomfortable, but this is existing law. I would rather end it halfway through that sentence, but if it's existing law, let's move on.
Okay. Any other questions about the resident piece? And I'm going to check that off unless there's questions there. I'm going to ask Teresa to send you you all an email from Mike O'Grady. He has weighed in on some of the definitions of a child and and so if we'll bring that up after, but if we send that out in his email, that would be great, Teresa. Let's move down past the resident. Now we'll move on to page 3. And Mike's answer may answer our question. Teresa, there you go, for the 17-year-old. This is where we're going to have to spend a little time about the establishment of the program and where this program should be run out of. And if we need to contract with a third party, or if we feel the agency of whichever agency we choose has the capacity to do it. Susanna, when you were looking at your original language, I think you were using ACCD. We were thinking, or at least I was wondering about the Agency of Human Services, because they have put out so many grant programs, especially revolving the welfare of families and children. And I don't know if there was some thinking within the administration that a third-party contract was not needed, but definitely to hear from groups to help identify and help with the application process so people weren't left behind. Can you talk about that a bit?
Yeah, so I think that in terms of whether it should be done in-house or the third-party entity, it would be, and this is a personal preference, but I would really appreciate if there could be permissive language in the bill that allows for the contracting with a trusted third-party entity if deemed necessary. Because I think that will give us more flexibility. So perhaps not making it mandatory, but rather permissive to say that we may contract with a third party to administer this program. And if that were the case, it would be helpful to include a cap on the administrative costs that would be allocated for that third-party contract.
Okay, thank you. So let's move down past 1, 2, and 3, because I think these have already been established in 1, 2, and 3. And then the program, this is on C, where we get into this piece. And so Susanna has put forth the possibility of including, if it's necessary, to reach out to to use a third party, and to cap, which is in this bill, but this was a combination of 3 different ideas. Do we want to talk about, I'd like to hear from the committee about which agency that you would like to consider to run this program, and your thoughts on allowing for a contract if it's deemed necessary. Do committee members have any thoughts on that? Then I'm going to put it on the table. I would like to run it through the Agency of Human Services, because of the nature of the group that's being involved, that's being considered. I just think it leans more toward the care of families and children. So is there any opposition? I will check with Mike Smith and Sarah Clark, but is there any opposition from this committee to go with the Agency of Human Resources? Mary?
No opposition. I cannot think of a better place to put it. Not only do they work with marginalized or underserved communities, but they also have access to language resources and experience in reaching out to communities who may not know how to work within our existing governmental structure. I think it's a great idea.
I just want to note that I agree. In all of what Mary just said is exactly right. But Kitty, you said Agency of Human Resources, and I think you meant Agency of Human Services.
I meant services, thank you. And then Marty had brought this up earlier, and Susanna, maybe you could to weigh in here. So in C1, the administration of the program shall be administered, and I think that we have agreed, I haven't heard any opposition for AHS, in consultation with the executive director of racial equity. And so the program shall be administered by AHS. I don't know legally if that means they shall consult with you. And I mean, so somebody
shall.
Well, it says shall be administered. But does the in consultation, is that a shall as well? It must be a shall.
From my reading, the consultation is also a shall.
Okay, and can you talk about the importance of your position working with AHS, if we should have a shall or a may there?
I believe that there should be you mean a shall or a may with respect to consulting with me?
Yes, because I think that the committee is going to agree that AHS shall do this.
Yes.
And should we dictate that to AHS? It's not that we're not considering you. Should we dictate that to AHS? If
You know, I would leave that to the committee. I can say that whether or not it's required by the statute, I and AHS will eagerly pursue that partnership. Actually, I ran into the Secretary Smith earlier today, and we chatted briefly about this, and we're both on the same page 100%, that I would be honored and pleased to be involved as deeply as possible in the administration of the program. So I leave it up to you to decide whether you make it permissive or mandatory, but you should be aware that either way, it'll happen, definitely.
It's going to happen.
I'll just weigh in to say, I think the legislature should take the position that the agency shall, or well, in this case, will work in consultation with the executive director. I think that's a policy piece that I would like to take that position on.
Okay, and so Chip, I'm going to put that on the table, and I think it's an easy one that we don't need to a long discussion unless there's some points that haven't come up. But if committee members agree to leave the shell there, can I, if there's any opposition, I'd like to know that, because if we're in agreement, we don't need to hear that. But is there any opposition for the first piece with AHS and with the executive director's position? Okay, I'm waiting for delays in some of our, then let's leave the shell there and let's move on to the next piece that the agency, no, don't go down too far, that the agency, go back up a little bit, Teresa. Shall, stop right there, please, shall partner with public or private entities as needed. Does that need to be a shall, or should that be a may? Let's just clarify these fine points. Kimberly?
Yeah, I'm thinking that could be a may, but I'm raising my hand on a slightly different topic in that same sentence. It gets to Peter's point about trust in a state issued check. I'm wondering if we could add in something along the lines or deliver assistance payments of state issued checks to eligible individuals. But I don't know if that's the right language because there may be electronic transfers or whatnot, but that may be a place to land what the actual vehicle is.
Okay, so before we move to the state issued checks, I want to stick with the shall or the may, and then we'll move to the last sentence there with the state issued checks. So Kimberly has put on the table, it could be either way in her mind. It could be a may. What are committee members thinking? Linda?
I'm definitely a may. I think that the Human Services Department has the knowledge, the experience, and everything else to do this. If they feel they need help from some other organization or something or other, the may works better than saying that you absolutely will get all done with everything. So I'm a may from the beginning on this one. Thank you.
And Susanna, do you have some thoughts you'd like to share with the committee on that?
I think that may would be perfectly fine. And if it were shall, I think that's still relatively permissive only because it says as needed. So it probably would get us the same result, but I'm very comfortable with may.
So then we would take out the as needed because
May.
it's a little redundant there.
Yeah.
So where would the committee like, I know it's a little point, but I want to get this language done, a shall or a may. Would somebody put a recommendation on the table and we'll take a position on it?
I will.
Linda has actually put a position on the table to change it to a may. So,
May.
if you agree with the may, it's a yes. If you'd like to leave it at shall, it's a no. And I swears.
Yes,
So back to the squares. If you agree, just changing it to a may as needed, raise your hand. 1, 2, 3, 4. Okay, we have a majority there. And if you want shall, let me just do the democratic way. I'll take a hand. Okay, we will change that to a may. Thank you, Kimberly. I got that. If we change it to a may, do we need to take out the word as needed?
Yes.
Okay,
Yes.
okay, thank you. Chip, are you taking notes on this?
Some.
Anyone taking notes on this?
We trust Chip.
Okay. And then we'll bring it back and we can clean it
Tell
up.
him where he was wrong.
Susanna, we talked a little bit about the delivery of the payments. And we really thought in order to start creating some trust between the state and others in Vermont that we wanted a state issued check, not to scare anybody or frighten anybody, but more of a goodwill and to start building this relationship. How do you feel about that?
You know, one of the challenges is that the population we're talking about, and we talked about this, I think yesterday, all the days blur together, but I think it was yesterday. This is a population that is often unbanked. So that's one thing to consider. I don't know if there's an opportunity for us to work with any finance institutions on the ground to serve as, I don't want to say safe havens, but trusted partners for folks who want to present their checks at those institutions. There's also, I mean, it's certainly easier if we can print up checks in-house and send them out. We can keep track of it much more easily. So perhaps that is a good solution. I'm not sure that there's a great answer here.
Marty.
Is a prepaid Visa card anything that would make sense? That way, it's not an EBT card for just food, but just a prepaid credit card. You know, those gift cards you buy at the store.
We pay, so.
No.
Pardon me?
We pay for those. I think that there's a percent that, you know, we'd lose money on them.
Well,
May I also
that would be a
add,
consideration.
Yeah, it's an idea that we should put out there, yes.
may I also add that just in the way of trust, I think any kind of a card, whether it's a gift card or EBT or what have you, always bears the shadow of your spending being able to be tracked. Even if the state of Vermont is not tracking people's spending with these cards, I can't imagine why we would or that we would, but the perception on the part of the recipient, I think, might be that. Also, again, this is a population, many of whom operate under the table or in cash or informally. And so issuing these payments in the form of cards might limit their ability to use the funds as nimbly as they might need to.
Marty, do you have a follow-up? We have some.
No, just, I understand that's an option. I mean, that there are difficulties with that, but I guess if we don't issue a check because people have difficulty going to a bank and we don't issue a card, how else will we get benefits to these people? I'm certainly not in favor of handing out a wad of cash. I don't know. What might be other options?
Well, I think we can do a check, but how they would receive where they would receive the check and where they could cash the checks. Is that the issue, Susanna?
Well, yeah, those are two issues that I can identify. I think if we're talking about checks, cards, or cash, a check would probably be ideal of those three options. And if we were talking about how they would receive and cash those, then you know, in terms of receiving them, again, that may be where it comes into play that we work with trusted third-party entities who may have the stack of checks physically. And we say, okay, go to the office of such and such organization, or go to your local health center. I forget what is the name for our state health department regional centers, but maybe that means going to one of those because they are the ones who have, or something like that. And then on the topic of cashing them, yeah, again, I mean, I wonder if there's some way that we might say, hey, if check cashing places in Vermont if someone comes in with this particular kind of check, maybe you have to limit the fees that you can charge to them or something like that.
Okay, so I have Mary, Chip, and then I have a whole long list, and this may be something that we take offline and some members work on it and bring back a proposal to the committee, because I think we could stay a couple of hours on how to cash checks. But Mary, if you have an idea, let's put it out there.
No, I think we need to take this offline, and there's the question. So I think it's a two-part question, is how do we deliver a payment to the individual, and then how does the individual receive the payment? You can't just hand the check. We need to think about how they're going to turn that check into cash. So there are two issues there, but rather than speculating it on here, I bet the treasurer's office may have some ideas, and maybe a couple of us could go off and think about that.
So I would like to know.
Not volunteering.
Yeah, I have a lot of hands up, so I want to know if with the hands up, Nolan, were you going to weigh in on this piece?
Yeah, I was just going to say that given some work I've done with things with DCF, there tends to be some administrative fees sometimes around EBT cards that don't exist around checks. So there could be, I don't know if there is or isn't, but I'm just flagging that there are different kind of administrative costs to do cards versus paper checks.
Thank you, Nolan. I would like to send this off to a work group, but if Chip, did you want to weigh in quickly?
Yeah, rather than, I mean, given if we had time, I would say, yes, us digging into this and figuring out a solution or possible solutions would make sense. We don't have time. I would recommend that in number 2 in that section, where it says the agency shall adopt requirements, guidelines, and procedures as necessary to implement and administer the program. I would add something like including providing how to provide payments to those who don't have access to banking services, or and address something to cover those two, that leave it to the agency to have a little bit more time and a little bit more access to people who can help figure this out. And I will just remind us that they will be working in consultation with Susanna. So the issues that we're bringing up here, the concerns, I think will be brought to them as they try to figure out how to do that.
So we're going to have a work group with Chip, who will work with Legislative Council and Susanna and with other groups to develop that language so that it addresses how we deliver the payment, how it can be cash, and how it can be equitable. So Peter, and then we'll go to Dave. Peter?
Yeah, so I just reached out to Chris Delia, Bankers Association. If we issue checks to individuals who have ITINs or are here under a visa or some other type of a government program, then the banks can cash the checks, no issues. If they are here, let's say under the table, then the banks will not be able to cash the check. So I agree with Chip's comment. We're going to need to put something in there to allow for the funds that we intend to get to individuals to be able to actually get to them.
So Peter, did you just volunteer for that work group on that language?
Dear God, I suppose I did.
Thank you. And thank you. And Dave?
Yes, I'll be quick. I know we're going fast. We don't have a lot of time, but I want to try to channel the work of Ruby Payne on Bridges Out of Poverty, who stresses how important it is to develop relationships with people to help move them to another place. Yes, this is a program aimed at doing a transaction. Say, are you eligible? And you'll get a check issued to you. And $1,200 is huge. But is this an opportunity to do much more than that? Can we work with a population that has a lot of needs, children who have language issues, who will at some point be entering our schools, families trying to integrate into the Vermont we know so that they can succeed? if an agency or an organization that AHS contracts out to has the power to cut a check and hand it to a person, that goes a long ways. And if they're trained to say it at the same time, Marty, if you ever have any challenges, feel free to come back here. We'd like to help you and your family. That creates, I think, an enduring relationship and an opportunity that will pay many dividends down the road to helping people in our country and in our state truly integrate and be successful. If I could think and give Chip a sentence or a sentence and a half to include in the language that might enable AHS to think about this or give them the latitude to do something like this, would that be okay? I may not be able to. I know perhaps Kitty, Dave, if you said, Dave, you're just moving too far into politics, I understand completely and I'll let it go.
Yeah, it's certainly worth thinking of. And then if it moves too far into policy and expands the bill into something else, we may have to come back in on it. The other thing we may be able to do is attach to the check a list of resources, available resources that they, you know, I don't know if it's a silly idea, but on a card that, you know, educational resources for your kids, or, you know, that they could contact, they would have contact information they could do on their own. But you think about it,
And I could
Chip,
be
and bring it
wrong.
back to the committee.
I could be wrong.
Oops, I missed you, Dave. You went out, or maybe it's maybe I'm unstable.
No, I stopped talking. No,
Madam
no, you're
Chair.
not unstable. I just stopped talking.
Okay, Susanna?
I'm sorry, I know we're moving fast, but I just had to say, I'm so grateful for the representative's comment. I think that's spot on. This is one step out of many that we're going to take to build or rebuild trust with this community. And I don't think I could have said it better. Thank you, Representative, for highlighting that.
And so Dave, work on language, bring it to Chip, and we'll bring it to the committee to see if we're just trying to stay within the lane, Susanna, because we're not the policy committee.
Of course, of course.
Too far, then we're going to trigger a bill that really needs to go to a different committee for full vetting. So Dave, you're on that. And then the next one, we have about 8 minutes, and then we have somebody else testifying. Number 2 allows that the agency adopt the requirements in the programs. And it also, Linda talked about, it's not going to trigger rulemaking. And I think that we talked about that when Mike went through the bill. So are there questions about not triggering the rulemaking provision? Let's go down to number 3. This is utilizing staff and resources. Are there any questions on allowing the agency in order to administer it? And then D comes into the contract for implementation, Susanna, and this is where you weighed in that you thought it was important to keep this if it's deemed necessary.
Correct.
And so Chip, if you could add those words, if deemed necessary, I think that's important.
Okay, before we go too much further, I think some of the real key questions that we had previously may belong up in the section we were just in, and those revolve around whether we set do we set any kind of a deadline for the program to be stood up? Do we set a deadline for people to apply and a time at which the unspent money would revert to somewhere?
Susanna, could you speak to that, please? When the administration was putting this proposal together, what the timing issue was, knowing that this money needs to go out quickly to help individuals? What did you think reasonable timing was? You had used ACCD, we're using AHS. So we're still using a state agency. Could you elaborate on some of the discussions maybe?
Yeah, so, you know, to the points about timing and deadlines for application and deadlines for us getting ourselves together, I think that a fair deadline for applications. I'm thinking about working backwards, which is why I'm starting with that. And I think a fair deadline for applications to be received could be the end of the calendar year. So about December 30th, December 31st. And so if we work backwards from that, giving the public maybe 2 months to learn about the program, because that takes time, to apply for it, and then to supply any other necessary documentation that may be needed. If we give them 2 months for that, then that would mean that we would have to open applications around October 30. And so I understand that we still have to go through a sort of legislative process, and I don't know what the timing looks like on that. So if we consider maybe a month and a half for us to complete this, and that's just me completely spitballing, I have no idea what will happen here, but it would be fair to give the agency enough time to stand up this program, to figure out whether it needs to contract with outside agencies, and that's going to take a little time.
So since the bill would move separately, depending on how quickly it moved through the Senate and then came back to the House without many changes or with no changes, it could ultimately get to the governor's desk by mid-September. And you're thinking that if we gave 4 to 6 weeks to set up the program and try to have applications open by the 30th of October, which would allow 2 months for educational purposes, getting documentation in order, having entities help individuals fill out applications, and then have a deadline for the application on December 30th.
That is what came out of my mouth, yes. But again, I would check in with AHS because they're much more aware of their own capacity. I don't want to speak on their behalf, but just on the topic of how long do we wait until we assume that the application, how long do we wait to administer this program? I think giving applicants until the end of the year would be fair. And if our process ends up dragging on longer than we expect, then I think that we should extend the deadline commensurately.
Thank you. Peter?
So this kind of goes with what I was saying, that the budget itself is a document that at the end of the budget time, unless we have indicated otherwise, money reverts to the general fund. So that would be my recommendation. I think that there's going to be a lot of things that the administration is going to have to overcome as they find them while they're trying to administer this program, and we need to give them a lot of latitude to be able to maneuver through them. So to put a fixed time frame by which we're going to revert any funds at the maybe March or April time frame might unnecessarily cause individuals who would qualify to not be able to receive. I think we just need to leave it flexible as possible within this budget year, and at the end of the year, 30 June, funds revert back to the general fund. My recommendation.
General fund, or back to the fund that maybe we take the money from.
Correct.
There may be
Yeah.
pressure.
Yeah, that's a good point. Yes.
Yeah.
Or back to the CHINS fund.
That would happen at the end of the calendar year when all.
At the end of the fiscal year.
Yeah.
End of the fiscal year, 30 June.
Fiscal year, yes, thank you. But she's saying a deadline for receiving the applications for them to have.
Right.
applications in.
And again, I think that we need to be very flexible here, because we're going to be talking to individuals that we're going to be trying to build trust with, and you can't do it with one conversation, I would imagine. So let's allow individuals on the ground maximum flexibility and latitude to be able to make this work.
Thank you, Peter. Okay. So we'll look at that December 31st, and does it need to be pushed out, or does it just need to be flexible? Mary, and then I think we're going to have to move to our next conversation. Mary?
My interest is in trying to get the money out the door to individuals as quickly as possible. So I don't care about the end date, but I do care about a beginning date. I will remind us that we heard from O'Grady that it took Ag 2 months to set up the program and a couple, 3 weeks to process the applications. So I'm comfortable with, I would like to suggest that we set a date of expectations on getting the check out the door, because I don't and let's remember how overwhelmed all of these folks are with other work we're giving them. And I don't want January to roll around and hear that they haven't started issuing checks or making these payments available to folks.
Well, in January, if we had a deadline of December 31st, the payments wouldn't start going out until January 1st.
If that's the conclusion, I wasn't clear on what the deadline that you were talking about was. A deadline to have a program start, to ask, I'm trying to ask that we set up something that gets payments out the door as quickly as possible, and to be realistic in that.
Okay, so because I do have somebody else here that I need to be respectful of their time, I need a work group, and I have Peter and Chip on the work group. And is there anyone else that would like to join this work group to, I think that we've heard above earlier of issues that we need to look at regarding the delivery of the payment and how to cash the check. But now it's also the timing of this piece and how to make it, as Peter said, fair and flexible, but also that we don't push it out so far that it just doesn't happen. Is there anyone who else wants to join in with Peter and Chip, or are we going to leave that a group of 2? Do I see any hands up?
I'll help. This is Marty.
Okay, so I have Peter, Chip, and Marty. And Susanna, thank you very much for coming in. And I'm sorry we didn't get through this language, but Teresa, if you just scroll up a little bit more from here, the confidentiality piece we've already walked through with Mike O'Grady, unless you have issues there, Susanna, that Chip can address with us. And keep going, Teresa.
Before you go any further, in D1 contract for implementation, you mentioned something and I missed that one a little bit, that Susanna had. I thought there was some.
Contracts as deemed necessary.
Okay.
I think that was the word that was used there, as deemed necessary.
The other thing I think that I had mentioned earlier was putting a cap on the amount of administrative overhead. So I think one draft of this had no more than $50,000 for administrative.
It is, it's on the last
there.
Okay, good.
So make sure that that is in your work. And I'm hoping that you guys will have some time this afternoon to work on this, because we really need to start shaping it up tomorrow and making a decision probably on Thursday. I know, Chip, you looked at the calendar. Okay, thank you. I think we're going to stop here. And if anyone in the committee has any questions, please move those questions on to Chip and Chip and Marty and Peter. And Susanna, will you be available to also if there's questions that you could answer as this work group works on this language and massages it a little bit?
Absolutely. I'm at your service.
Thank you. We appreciate your help. And I'm sorry if I seem scattered, but I have 100 billion budget things that I'm thinking about at the same time that I'm trying to concentrate really and be focused on an important piece of legislation.
I think you're doing it very well, Madam Chair. So no apologies needed. Thank you all.
Thank you. Committee, just as we're really good at this, we're going to transition from stimulus equity right into the Department of Motor Vehicles. There was, I sent this on to Bob, and I should have put you in here, Marty, because you do have IT projects. There was a provision in the governor's budget for $1.2 million for an IT project in the Motor Vehicles Department. And, we're working on some of those funding sources. And my understanding now is for the DMV IT project. It is a $900,000 cost for that project. And so we have who is joining us from the Department of Motor Vehicles? Do we have the Deputy Commissioner? Is that who we have?
Madam Chair, I'm Director Tony Fakis with Enforcement and Safety.
Oh, I thought
We don't have a deputy commissioner.
Well, Tony, welcome. And I thought the deputy commissioner was coming, but since we don't have one, we're very happy that you are here. And we understand that you can explain what this IT proposal is to our committee and the cost, if it's 900,000 or what the cost is at this time. Mary, did you have a question before Tony starts?
I don't have a question, but I guess I get a point of what I consider personal privilege. It's so fun to see Chief Fayko sitting there. Tony retired from the Montpelier Police as our chief less than a month ago now. And I'm delighted that you're still around, although we're going to really miss you as our top cop in Montpelier. But it's really fun to see you. Thanks.
Well, thank you so much.
We're expecting all the ins and outs. You're on this job just for 1 month?
3 weeks to be exact.
Excuse me?
3 weeks to be exact.
Well, then you must know everything about this IT program. We're excited. We're going to test your 3 week skills, your learning curve here.
Okay.
And give us an overview if you would, please.
Thank you. I think that the quickest way to start this off, we have a six slide PowerPoint. I'm not going to do death by PowerPoint, but can we load that up, please?
Teresa, do you have it?
Hey, at a moment with PowerPoint, just hang on. It's ready now, though.
Thank you. Next slide, please. So the current state, how inspections are managed right now, is, I think most of you are aware, 2017, Vermont launched an automated vehicle inspection program. What that essentially means is that of our 1,173 inspection stations in Vermont, they all have a digital tablet that is used to go through the inspection process. And there's also a regulatory component that our inspectors maintain, ensuring that vehicles are properly inspected. So the system has the stickers that we all know that are regulated. And what happens is that the dealers in the inspection stations will have the old sticker system. So in other words, they order what they think they're going to need. When they need more, they have to, right now, because we are not doing face-to-face with those resupplies, they have to go through an online order form, and then additional books of stickers are then shipped to the inspection stations. So, and then at the end of the unused ones then also have to be brought back to us, and then we store them, and then we ultimately destroy them. So the businesses have to have an escrow account with DMV. So in other words, they can't just do it automatic, pay as you go. So these stickers, if we can go to the next slide, please. So by having these stickers, the dealerships, the inspection stations, they have to maintain these, and there's a regulations, and there are regulations in place, administrative rules, I should say, that require them to be secured. They also, if they fail to send them back, we have to then do an investigation into the business, provide education, and at some point also issue penalties. So this could be like a 12-page investigative report to issue a $100 to $120 fine to a business. So to me, also, that doesn't really, fit well with government trying to support business. And it's quite frankly, it's an archaic model. So, and then also it's a huge waste, which we'll talk about in a bit. So the goals by having the print sticker on demand it's a proprietary printer that is then connected to the tablets that are out in all the inspection stations. And so only when a vehicle effectively passes an inspection can the mechanic actually print off an inspection sticker. So there's also an accountability with that sticker. And you know, if the emissions weren't correct or whatever, no sticker could be placed. So there's that advantage as well. And so back to the waste. So with all these stickers are being made, we buy them ahead of time to a cost of roughly, I know the current one is $102,000 order. And for those that aren't being utilized, they have to be destroyed either by us ultimately. And there's also an additional sticker that goes on, which is the numeric month sticker that goes inside the inspection sticker itself. Well, unused stickers that the inspection stations would have, they have to destroy them. So it's in this day and age, it's just to me, it's a significant waste, not only of materials, these are vinyl-based stickers, but also the shipping, the back and forth with UPS or Postal Service. So one of the goals is to go beyond that system. So again, it's more effective. And the black market, as a police officer, I've investigated burglaries many years ago of businesses that were broken into for their inspection stickers. And the black market can be anywhere from $100 to $200 a sticker. So there's that. Plus, there's also other liabilities as well, such as we're managing cash, and it's not a contemporary way of doing business. So, and the other benefit, besides really being business friendly for not only the inspection stations, but ultimately the vehicle owner, the consumer. So if their car was scheduled to be inspected and the business does not have their amount of stickers, then there's a delay there. And also it allows businesses to more effectively manage their cash flow. And the benefit to us here at DMV is going to greatly reshape how we do some of the administrative process here at Enforcement and Safety. And so the estimates can be anywhere from staff savings of up to upwards of $90,000, and of course shipping savings for all involved could be also upwards of close to $100,000, give or take. So that's some of the benefit to us as we try to modernize, and how the sticker inventory and all the support for this is with our current partner/vendor, which is Parsons. And Parsons will manage the ACH for the businesses so they can get things real time as they need, tech support, and it's a much more efficient way of doing business. And it also, again, frees up our investigative time as well to more important motor vehicle safety goals. So next slide, please.
Can I ask a question there, Tony, please?
Yes.
How do vendors feel about having to purchase and maintain the printers? Do you feel that you're going to get pushback from the vendors? Are they special printers that have to be purchased in order to do these stickers? And what is the cost that will go to these small inspection stations?
A great question. I apologize. The plan is for us to roll those printers out, us being the state, through this part of this appropriation of $900,000 that we're seeking, is to supply the printers and the support. And also as we go forward with, right now we're in contract renegotiations with Parsons. So our plan is that we do not want to have a fee or cost increase to either the inspection station or to the end user, the vehicle owner.
Okay, and I'm sorry if you covered that. I was just reading the PowerPoint and I ran to get a glass of water. So if I had missed that, I apologize.
No, I did not cover that, so thank you.
Okay, thank you.
Again, the vendor's really going to pick up a lot. Parsons, they've been very, very good partner for us, and this is really their expertise. And so again, they will be taking away a lot of the administrative burden that we've been for both us here at DMV as well as the business. Next slide, please.
I have a question from Representative Fagan.
So Tony, thank you for coming in. Is this an off-the-shelf system? Have they been using this successfully in other states?
That I do not know to what extent. I do know that they have experience with even merging both registration and inspections, but I don't have any data. I apologize for that, but I can get that for you
And
regarding.
it's not so much data. I just want to make sure we're not the first guinea pig off the, coming out to see if, hey, let's see if this works.
No, especially where I don't think so. Especially where we are at with the real brains of this system is the tablet that we already have rolled out.
Okay.
And there was some frustration, my understanding, back in 2017 with that rollout. So it's now a very proven platform.
Thank you, Peter. And Bob, a question?
Yes, yes. My question is the lifetime of the machine. What is that? Do you have any idea?
I do not.
Pardon?
I do not have a guesstimate or information on the lifetime of the machine.
Okay, so you probably don't have the cost to maintain it. And I guess that cost is given to DMV because it's their machine, right?
It would be this along the same lines as how we currently manage the tablets. And so.
Yeah, but this is a printer, if I'm not mistaken. So you got a little more moving parts there, don't you?
Yes.
Yeah, I know all about my wife's printer and printers at the State House. I know about a little bit about printers.
It's similar to what would be could be in a cruiser with e-ticketing, where it's a thermal printer. That kind of technology, even on our parking enforcement uses, thermal printers on their handheld units. And I can just, my assumption is that it's a very similar technology, but I can find out for sure what the lifespan is, as well as the operating costs.
Yeah, I'm not trying to be negative, but they are in a garage, and those aren't many of those are not the cleanest of all places. And they've got the doors wide open all summer, dust and dirt and some grease. And I mean, it all lends to shorter lifetime of machinery like that. But anyways, okay, thank you. I guess that's it.
But I will follow up, get back to you on that.
All right.
I have Diane and Kimberly, and then we will finish the PowerPoint.
Thank you. Thank you. So I've got a kind of a similar line on the printer. We've seen some of the reaction on the public when we made some changes to the laptop or rolling out the tablets, is pose some or expose some difficulties for people to make that transition. And I'm just foreseeing that this might have the same sort of issue. So I'm wondering if there'll be not only just the printers provided, but sort of a help desk after you've taken the class. And now, like Bob says, I'm working in this shop and I go to print this completed thing and it gets jammed, and can I reprint, and how did I lose it? And is there a help desk going to be available?
I don't
Sure.
want to be there.
Part of the contract, which is to be final, is we're still working on with Parsons, but certainly there were a lot of lessons learned from the rollout of the initial AVIP system. And one of the other things that we would foresee going forward from our department's end is that if we are true to, our plan is to make sure that there's no cost for starters to the public. So we want to get the message out in an effective media campaign, both with DMV and with Parsons, so the public's not expecting a new cost. So because one of the things also that happened where there were charges that were not necessarily related to the actual cost of doing business when my understanding when AVIP was first rolled out.
Mhm.
So also with Parsons, that is absolutely their wheelhouse. They are subject matter experts in their technology and the accountability of the system, and they are to be there as part of the contract to support all of our inspection stations. And again, whether they need resupply, whether they need another printer because one's failed or something, whatever, that is to be still determined. But they've absolutely are going to take that on, and they have done that with other projects in other states. I just don't have the specifics as asked earlier regarding the printer.
So no, so it would be important for us to know, and I may not see you for a little while once this goes in, but we will hear from people saying, oh my goodness, my inspection just went from $2 to $20 because you made me have to do X. So that would be a flat out, no, it should not cost you anything more on the inspection stickers or inspection process.
That is correct. For the first year, again, that is the goal. That's why, again, we need this funding opportunity to get this off the ground, to start, realizing all the benefits and efficiencies that, I laid out earlier. Because the plan is this year is not to cost anybody in the public and business additional money. And we need to make sure that's why we have to get the messaging out as well. So a station doesn't say, well, I've got this new printer I had to acquire, and because of the addition, whatever, we want to make sure that message is clear to the public.
Okay, thank you.
Thank you. And Kimberly, and then we'll finish the PowerPoint, Tony.
Right. Hi, thank you. And hi, Tony. So my question is, how many inspection stations are there in Vermont?
Currently, we have 1,173.
Okay. And so if I'm heard correctly, so the 900,000 you're expecting to serve 1,173 stations and that's going to cover everything. And then you would have the add-on of the cartridges. And then I assume, like any IT, there would potentially be upgrades. I guess I'm rather skeptical.
Well, that was again, last week, the commissioner and I, we had conversations with Parsons as far as so they are clear as what our expectations are, which is again, making sure that we don't have an additional cost to the consumer and on this rollout, and that they can effectively manage, as I've described, this project. Again, the bulk of the project is already there, and that's the tablet, that's the inspection process. This is adds just an additional layer of, one, security and accountability in the inspection process, and number two, it actually makes it much easier and more convenient for these inspection stations.
Thanks. And just real quick, though, what I did hear too is you're expecting a no cost increase. You said year one, and after that, we don't know. Is that correct?
That is correct.
Thank you.
Thank you, Kimberly. Bob, and then we will finish the presentation. Go ahead, Bob.
Thank you, and I'll make it quick. Yeah, the cartridges are paid for by DMV, at least for the first year, right?
We're still working out the details, but yes, we want to make sure that we're not putting on an additional cost to the inspection stations.
Okay, and after that, my chair's gonna love this one, but I'll make a deal with you. I'll vote for this if you can get the rust above the back wheels of a pickup box taken off the reason to lose an inspection. There is absolutely no.
I don't think we make deals like that. I don't think we make deals like that, Bob.
Pardon me?
You don't make deals.
Yeah, you can. Yeah.
Appropriations.
I don't hear an answer. Thank you.
Good try, Bob.
Yeah, well, it doesn't make any sense. That's why I tried it.
Tony, would you like to finish your presentation or?
Sure, I think we're pretty much done, but next slide, just want to make sure.
Oh.
So we already talked about the benefits to all, and quite frankly, all involved with this. And then the last slide, please. It's just questions.
So, oh, sorry.
Okay, so the PowerPoint, we're done with that. So thank you.
I think you talked about the fraud prevention and in those pieces. Diane?
So I do have a question around the money, because you talked about 900,000 and in the budget there was 1.2 million. So I'm seeing a gap there, and if you could talk to me about what's going on with that?
Sure. The initial 1.2 was talked about, and we thought that's what it would cost. And then after our conversations with Parsons last week, we were able to get him. It's still not a formal detail, but that's where we came up with the 900,000 to launch this as we intend.
So, okay, it's not like you had 1.2 million and this was only a part of it, so you're not doing something else. It was 1.2 was for this whole project, and you were able to get a tighter bid, so to speak.
Correct. And just to be clear, we still, because we are, our AG is still working with Parsons. We're still, and one of the big issues, are we going to be adding to that contractual relationship this whole project or not?
Yeah. Okay. Thank you.
Thank you, Peter.
So if this does not work, it is rolled out and it does not work for whatever reason at one station, two stations, all the stations, what's the fallback plan?
The fallback plan is really working with the vendor to make sure it does work.
If it does not work, however, I mean, if for some reason or other it just won't print, or the printing comes out wrong, or whatever, is the department prepared to come up with a plan B? And that may be that everyone inspections and registrations get pushed back months until it gets repaired and caught up.
Well, I've not put together a contingency plan for that at this time, but my assumption would be, since we do have stickers for 2021, that we could in fact deal either with case by case, again following our inspection process, and with a qualifier, which would, whatever we would need to do. But in this day and age, though, sir, between computers and cruiser police cars, printers and police cars, printers for our meter enforcement personnel, and I in my younger day, pre-police days in high school, I did work on a garage and an inspection station, and so I know what they're like, and it's hard. But I think this is moving forward. We're heading in the right direction, and I think it's important that we head in this direction.
Oh, I absolutely agree. I just think we need to, as you said, plan for all contingencies, and that's what I'm asking about. So thank you.
And I do not have that contingency at this time, sir.
Yeah, thank you.
I just wanted to ask quickly, Steve Klein, I think you're on. Steve, this wasn't one of the IT projects that the Joint Fiscal Office weighed in, that Dan Smith weighed in on, was it?
No, this was not.
Okay, I know that I'd asked for a series of them, and I thank you, Marty. I was just scrolling through and I was looking to see if this was one he weighed in on. Are there any final questions for Tony? Thank you very much for coming in, and good luck in your new position. We wish you well, and we're glad we got to see you so early on. This is good.
Thank you very much for your time. Thank you.
January. Okay, thank you. And so the reason that I asked for this discussion was because I've told you that I've been working on this thing to try to figure out funding for the Vermont State Colleges, and part of it was with the transportation dollars that we took from the general fund that we did not accept going into the T fund. And 6 million of those were for transportation projects, but there was also this DMV IT project. And at this point, if people have comments on the IT project, give them to Bob, and he is working with the Transportation Committee, and those will be part of their deliberations. But Steve, did you want to now talk about this possible construct for the committee to consider to identify general fund funding for the bridge money for the state colleges?
Sure, and I actually put this into a PowerPoint because I figured, first of all, PowerPoints are, I haven't done one in a while. So it's not a very fancy PowerPoint, but it'll allow you to think about what I'm saying. So the goal was to sort of solve the remaining VSC bridge funding need. And we get 23.8 million. We switch to the next page. And the original request, this is right from their chart, You gave them 5 million in the FY21 budget, and we had already given them $20 million of bridge funding CRF. And then they had 4 million carry forward, and so the remainder was 23.8 million. And one of the problems we've been working with VSC is they pretty much have exhausted the way that they can creatively use CRF funds under the current guidance. So that was probably why the administration put $30 million into a fund if the guidance were to change. But our problem is we wanted to go home and make sure they had a bridge. And so the question is, when you couldn't use the CRF money, we had to think of a different way. So next slide. And people should stop me. I'm just going to race through this.
Yeah, and I want you to slow down a little
coherent.
bit. Just slow down a little bit.
So the proposal, the 4 elements of the proposal is to use the CRF in the state police and health department, free up general fund and transportation funds to enable the VSC funding. And it uses 24.6 million in CRF funds and produces 23 million, well, 23.8 in general funds. And I'll explain this as we go through this. But what we're doing is we're sort of taking the CRF money, putting it in departments that could absorb it, and freeing up the funds to make this project work.
So just if you would
Next.
stop on number, Steve, if you would just stop on number 1, when you look at the guidance for the use of the CRF
Right.
money, looking within the health department and looking within public safety are 2 areas that have a true green light. For the
Right, next slide goes into that a little bit.
Okay, thank you, Steve.
Okay, so the next slide is the guidance, and just the flagging the yellow part. The guidance says that funding can be used to meet payroll expenses for public safety and public health. Then it says it was designed to provide ready funding, and for this reason, as a matter of administrative convenience, in light of the emergency funding of this program, a state, territorial, tribal government can presume that payroll costs of public health and public safety employees are payments for salaries is substantially dedicated to mitigating and responding COVID-19 public health emergency. So unlike many departments that have to actually, tally up the hours, these 2, there's a presumption that these are eligible expenses. So for this reason, we decided to sort of work with these 2 departments.
Any questions on the focusing on health and public safety? I'm not seeing any, so let's continue. Steve. Oh, is there one?
Sorry.
I'm sorry, Mary?
So I understand it says public health. Is it larger than just our health department? I mean, could you back it into all of the public health services that we provide, say through the designated agencies, et cetera?
So I would just say we stuck with the public health department. The language that, whenever you sort of go broader in that, I'm not saying no. And I think that's going to be one of the things that we're pushing an envelope here, but I wouldn't say this totally, I don't know, I probably would have asked Jen Carby to opine on that because she would be more closer or guides, whatever, Guidehouse could talk about that.
Okay, so Mary, you will take that question, whether it can be expanded into the Department of Mental Health and find that answer. Steve suggests Jen Carby, or I don't know if we have direct access to Guidehouse legislators. I'm going to move to Peter and then Maida.
Thank you. Steve, just regarding for public health and public safety employees, that's a broad statement. Does it need to be quantified more? Is it every Vermont state trooper that's on the road? Is it every member of the Vermont Department of Health?
Well, so these are good questions, and it'll come up to be an issue in the next slide. We'll talk about that.
Okay.
I think that the way it's written, in the way there is a presumption here, and I think the question is, if you were to say everything in the whole department, that you might be crossing a line. I don't know. It isn't really clear. The guidance is noted for being not really clear. But this is a little bit, well, let's go into what we did in public safety and then we'll talk about it because I think it is relevant. So what we're doing.
Maida
maybe
has
we
a
can switch to the
question.
next slide.
Steve,
Oh, go ahead.
Steve, before we move on, Maida has a question and then
Yep.
we'll move on.
Thanks. Unless I misheard, Steve, I think I heard you say the words working with the Department of Public Safety and the Health Department. Does that mean that both entities are aware of?
No.
Oh, okay.
Public health is, and public health, I've worked with them. I have to tell you honestly, the state police I have not talked with them, and I think that's going to be an issue. We need to communicate with them, and they are, it's definitely a big deal because not only are we substituting dollar for dollar, they're going to have the same dollars, but you're putting in CRF, which is not like base general fund and T fund. So, they're not going to be, well, if I were a business manager over there, I'd be like less than just like other departments that are seeing CRF being used, but it should be replaced next year. It's a one-time event. And, but I have not gone over this proposal with them. It's a fair critique.
Okay.
This is truly a one-time swap.
Yeah, but at some point that connection will be made, yes, sooner rather than later.
Yep. And I must say, one thing I probably should have begun with, I'm actually like, and this is finding 23.8 million in the budget is not ideal. And there is going to be, whatever we do, there'll be some pain. And so I do think in this case, this is an issue. And you're about to get into the gray area with the state police on the next slide.
Okay, let's.
So let's go down one more. Ooh, this is going to be impossible for anybody to read. I didn't realize how small it would be. Let me try to explain what's going on. Okay. So the state police personal service budget, just for state police, not for public safety, is about $60 million. We put in 43 million of general fund and 20 million of T fund into the overall budget for the state police. So, and some of it goes for non-personal service expenditures. So it is more than the amount that's actually just being used for personal services. What we've done is, since we can only use CRF for the first half of the year, we took those numbers and sort of divided them in half. And your general fund is 21 million and your T fund is 10 million. And what this proposal does is it takes 68% of the state funds or 72% of the personal service amount and replaces those with CRF money. So what we're doing is we're not, and that's only for the half year. We're basically using CRF money rather than the general fund and the T fund. And that allows us to, for this half year, harvest the 14,890 of general fund and 6.9 million of T fund. So then what would happen is
just say, before you go any further, I want to make sure we haven't lost any committee members where the swap is. Do I have any, are the committee members all follow that piece? Okay, perfect.
And then, so the theory is the 14,890 general fund, we will move toward this money we're gathering for VSC. The 6.9 million of T fund will go to fund what the governor proposed, which is $6 million for the AOT and 900,000 for DMV. So this will actually allow you, I know initially the committee was not going to fund those projects, but this would allow that money to be used. Since you're not spending it in public safety, you're spending it for AOT and for the projects. And what'll happen is, since you're paying for those with this T fund, the 7.2 general fund that the administration was going to use is freed up and gets added to this collection of dollars we're using for VSC.
So Steve, I just want to stop right there. We only made the decision not to swap out the general funds for the T funds. We didn't say those were the projects we weren't going to fund. That was going to be a conversation with the committee.
So all this does is it says those will get funded with T fund.
And so when we did that, when we said no to the swap that was in the administration's proposal, we freed up 7.2 million and set that aside for the Vermont State Colleges. This provides another 14.89, and which brings us, well, a little bit bigger total because we have the other two $200,000 because we didn't know the cost of the IT program was just 900,000.
Right.
Bob, do you have a question?
Yeah, for Steve. Do you think you can pull this off?
Well,
This-
you know,
this
I
is a
think it's,
game.
I think it's, the thing about we've done a lot of moving in CRF money, and there's sort of this thing where something is pretty black and white, and I think this is pretty black and white. The question that I was asked is probably the right one, is how much can you take out of the state police before you've crossed a line? And I think you can. I mean, we have taken a lot of risks in the fund, and I think this is doable, but I think the administration, it's a good news, bad news for the administration. The good news is that they were funding the 6.9 million, found a way to fund the 6.9. I don't know that they are going to welcome it with open arms. Do I think it's a legitimate expenditure? Yes. I haven't really gone over it in a way with the administration that can guarantee it'll work.
So I want to remind the committee, sprinkled throughout our entire budget, and if you take the web report out, you're going to find where the administration used 18 million of CRF dollars and have swapped them out, sprinkled all through this budget. And so if you report, you're going to find, you know, areas where there were legitimate expenses, like in building and general services, there's a line, Federal Coronavirus Relief Fund. Well, that for 1.5 million. And so I went through the budget to see all the budget areas where there was legitimate swap out of CRF dollars for general fund. There are several, and these two areas were areas where there were no swap out, and it would be available according to the guidance that we read up above. And so it's really, it's in line with what is already happening within the budget. It just allows two areas that are clearly qualify that were not used to do so. Maida?
So, I'm sorry. I'm kind of breathless here, looking at these numbers. Is the bottom line that when we get finished taking money from here and putting other money wherever, that I'm just going to look at the state police issue here, that they'll have the same amounts as appear presently. It's just that the source is from a different place.
Absolutely.
It's going to be CRF money.
Yes.
That we know is legit.
They will have exactly the same money. From our reading of the guidance, it's going to be within the guidance, and there's nothing in the guidance that we can see that prevents this. Yes, you're correct.
Okie dokie. Oh,
And,
please, you're
yeah.
gonna, you have written on a notepad somewhere, talk to DPS soon.
Yeah, and
Please.
and to be honest with you, and he can speak for himself, I've talked to the Commissioner Gresham about it a little bit. I know they looked at this exact thing earlier, but did not need the money, but they will have their own interpretation. And it's, I want to let them speak for themselves. But I think that there probably is going to be more. If you would ask me where the vulnerabilities are in CRF money usage, I don't think it's here as much as I think it's in probably economic development areas, just because of the nature of fund uses. But that's a whole different story. I mean, we have different levels, like in housing area vulnerability. I think that, as the chair mentioned, and we are looking at other areas where the Senate is looking at other areas where they can maybe utilize CRF money to produce savings. So this is the most.
Thank you. Thank you.
These are the two areas where you have the most legitimate guidance. All right, why don't we go to the next page, and there'll be a summary. We can ask questions generally after that.
Okay, let's finish the summary, and then I have a question from Chip and Marty.
Sure. Okay. So actually, I was going to move on to the health department, if that's okay. If not, you want to keep going with questions either way.
Let's do the two questions, these two,
Yeah.
and then we're going to move on to the health department. Chip and then Marty.
Mine is pretty general. Why don't I wait till the end?
Okay.
Okay,
And Marty?
good.
Yeah, mine is still specifically on that chart back.
Sure.
Regarding the transportation money, 6 million was general fund that they wanted to use for transportation. And 1.2 for the DMV project was also general fund money. Are you?
Correct. Yeah.
It looks to me like that here that we're not going to spend that 6 and that 1.2 for those purposes. Instead, we will spend it for the state colleges. But my question is, are those two projects still going to get funded somehow?
Yes, because what you're doing
Back
is
in
you're freeing up
transportation.
6.9 million of transportation funds. And the way that frees up is you're not spending 6.9 million of transportation funds. So then AOT can use transportation funds to fund those two pieces that were previously scheduled to be funded by general funds. So you're going to be funding the same things that the governor proposed using transportation dollars, not general fund dollars.
No, we're going to be using CRF dollars.
Okay, and we're freeing up, what we're freeing up from transportation is the personnel cost. Is that correct?
We're freeing up the money. We're covering the same costs of personnel with CRF money. And so what we're freeing up is the state transportation dollars.
That would have been spent on personnel.
Yes.
And we're using CRF
Yes.
instead.
Right, exactly. Bob, is yours a now question or at the end question?
I don't know. Can be either, I guess.
Go ahead.
Either way.
It's basically just a statement, if I can.
Okay,
And all I wanted to do is say, I think we more informally though, talked about stuff like this at the beginning of COVID, the whole thing, and didn't know where we were. And I don't think joint fiscal had a good feel for it. My point is, I think what's gone on here is joint fiscal has learned a lot about the whole system as it progressed over the last, whatever it is, 4 months or 5 or whatever, and feels more comfortable with it. Am I somewheres near correct on that, Steve?
Yeah, and we could use, there are a lot of other alternatives. I don't want to tell you, you could spend reserves, general fund reserves or things like that to cover it, or you could cut programs. We tried to find something we felt comfortable doing according to the guidance and utilizing that CRF dollars in a way that could be defensible and would get the money to the state colleges. So this is just an attempt to build a bridge that is funded without going to the reserves and without taking it out of other departments' budgets. But it does put CRF dollars into the health department and the state police.
Does this come out of what's going to be the second? What group of
Well, let me say that again.
What group of CRF money does this come out of?
The administration set aside $30 million for state colleges. So we're going to be using 24.6 million of that money. That's of the money that was set aside for the state colleges. The rest of the money is freed up for other CRF needs that the House determines are worth spending money on. I think one of the things that's probably going to happen, well, I should just come to that later. Maybe we should finish this.
Steve, could I just expand on this? What the administration did, they set aside, it was called Tier 2 of the $30 million for the Vermont State Colleges. That was called Tier 2 with the condition that the money, the guidance actually changed that would allow for that money to be used for the Vermont State Colleges. What we have done here is found an approved use of the CRF money, and that way we can use general fund dollars for funding.
Yeah.
So the administration did set aside 30 million, but it was under the condition that it became approved or the guidance changed.
Maybe if I could go through the public health, and
Yep.
that is the easier one. I think that you're all correct. The state police is where the larger money is. So the health department, they use CRF extensively, and it's being used.
Just a minute, Teresa, would you move the screen to the health
Yeah.
department, please? Thank you.
And so they've been used, and their current projections is they're going to go through the CRF we've given them by November. and they could use more CRF. So what they've been doing is using CRF and freeing up general fund and other funds in the process. So like they've been using CRF to do testing, and they know they're in that category of a lot of their operations can be funded through CRF, and they just don't use as much general fund. So what we talked to them about was, and they may have a need for testing in nursing homes, and so they could use, what their need is another 2.5 million of CRF would be useful for them. They think that they could absorb a reduction of 1.71 million in general fund if they were to get that CRF money. And what they would do is, given their tied in global commitment money, the actual total reduction would be higher than 1.7, but they are in the process of saving state dollars and, in rough terms, about $1 million a quarter. So this is well within their, the amount of money that they're being able to save in general fund. So this construct says we give them 2.5 million in CRF, and we reduce their general fund in their budget 1.71 million. And this one, I have had a chance to talk to them. I mean, part of the thing is, as we all know, this idea didn't come up until late last week. And then I just today and yet been able to get in touch with them. And I have not talked to public safety, but public safety is the bigger ask. This one is only 7% of the personal services. And it's, and part of the problem with this, part of the problem why it's much less is in the Department of Health, virtually all the general fund is linked to grants and linked to match. And so you really can't take much general fund without creating a sort of complex set of relationships. So we did check with them because of that. We were very nervous about taking general fund. They have a lot less. They only have 11 million total. So 5.5 million per half year.
Teresa,
and
can you move the chart up,
1.7.
please?
What?
Just Steve, I just need the chart moved up so we can see.
Oh yeah, I'm
the-
sorry. So their total general fund is 11.1 million. Their half year of general fund is 5.5, and we're taking about 30% of their general fund for the half year. So it's a pretty big chunk of the general fund, but it's a smaller chunk of the budget. And this one, we did check it out. So
Madam Chair, I'm having a problem getting it all on one screen.
Well, we don't have to see the top part.
yeah. So that's that. And then let's see. So the last thing is one slide more, and I'll just flag it. And again, I'm sorry about the small print. You can make it bigger. So we start with the 23.8. We're taking the 7.2 that would have been the governor proposed using 7.2 million general fund and using it for AOT. We're taking that 7.2 that is being funded at 6.9 T fund because the cost went down from 1.2 to 900,000. We're taking 14,890. That's the general fund recovered from the state police. 68% of the general fund for half a year. Then we're taking 1.71 from the public health, and we're giving them back 2.5 million of CRF funds, and that reaches that's the 23.8 million that the state colleges would get. So we would appropriate to them 23.8 million of general fund.
Okay, so let's bring us back to the Hollywood Squares, and I have a couple of questions. Chip had a question, and that's the only hand I see right now. Chip?
So I've been getting a little bit more comfortable in my understanding as this has gone on, but let me ask Steve the question. It makes complete sense to me that these are two areas, public safety and the Department of Health, where CRF funds might be would be eligible for the use of those funds, and sounds like they're underutilized up to this point. What I'm just wanting to make sure of, and if you've talked about this before I returned from the other committee, I apologize. But so, for example, in the Department of Health, we give them $2.5 million of CRF, and that allows them to free up 1.7 of general fund, and that I assume is because there are restrictions on the way the CRF monies can be used, and that's true with all of the CRF money. So I just want to sort of have reassurance from you that that in doing the swap, while the math works, that we're giving the CRF money and freeing up general fund, that we're in providing the CRF as a substitute, we're allowing them, where they still have the flexibility to spend that money in the way that they need to carry out their mission, because the CRF money will come with the guidance and the limitations on how it can be spent.
Yeah, the real reason, and again, we can bring the public health thrown in there, but my impression is it's less about the CRF restrictions and more about that general fund matches global commitment dollars at times. And so there's a match there. So you're actually needing more CRF money to offset that. The money, when you're not just losing the general fund, you're losing some of your global commitment dollars too. So the 2.5 million gets them enough to meet their needs. At least that's what I was told. They may come back and say it needs to be a little bit more, but I don't think so. I think that's probably, I was told that would be a right number to be able to cover their needs. And so that's what that's about.
Okay, so that makes sense to me. That seems logical. I guess just to the other point, do we have some, understanding, and maybe we just need to hear from them that in swapping CRF money for general fund dollars, it still allows them to use the CRF money, or they still have the flexibility to spend that money in a way that allows them to carry out their mission fully.
Yes, and I think that is, and one of the problems, and I just want to flag a concept here that I think it does, but you have to realize that every time we use CRF dollars, and I think this goes back to a point the chair made, every time we use CRF dollars, it's putting a one-time money in when you have a base issue. So we are doing all this, and every department, I'm sure especially the state police, and I'm sure Sarah Clark and others are going to say, you're giving me one-time money, and this comes with a responsibility the next year. You can't give me that CRF anymore because it's not there. You're going to have to give me back that underlying appropriation. So I think that's going to be every agency that gets CRF dollars. On the one hand, they'll be okay with getting the money. On the other hand, they're going to be nervous because it is their functionality depends on getting their base money in 22.
Peter?
Good, I am unmuted, good. I'm in support of this. I understood Bob's recommendation last week regarding the use of reserves, but what this does is that it maintains the reserves, and should we have a need for paying back somebody because we have done a little over the line too much, we have those funds available in 2, 3, 4 years. The federal government isn't fast. They come back in years later and audit you and claw back what they want to claw back. So, this way we can retain the reserves there and have them for whatever need that we may have. But one thing, and Steve just talked about it, we're going to have to swallow hard on. There's no such thing as one-time money for one-time uses in this budget. And due to COVID, I'm okay. Thank you.
Yeah.
Thank you, Peter. Dave?
So-
Diane.
Steve,
Yeah, if I could just stay on that, because the college is a bridge fund is one time, correct? I mean, it's one time. We're just swapping out the CRF for one time. So it wouldn't be my expectation that next year we've set the table for colleges to have another 23 million as a part of their base. This is a big project for them to bridge through, right?
Yeah, but I just want to be very clear about that because it is a one-time bridge, but they have a study going on right now that's going to come up with results next April. And I would be very surprised if the bridging doesn't, maybe a lower bridge, but you're probably looking at 2 years worth of bridging. And my hope is, you probably all know they just yesterday got a $8 million grant for VTC, which is going to allow them to do basically build a capacity at a campus, bring in more students, but we're bridging to an unknown because we don't really know what they're going to recommend for the school. I would be very surprised if there isn't a second year bridge requirement. It's just, I do also think it may be lower than year one.
Thank you, Steve. Dave and then Marty.
Steve, just to clarify, does this plan that you've outlined make available another $6 million in CRF to be reinvested?
No, it
Governor
uses.
started with 30.
The governor started with, yes. The governor, it does make available. It does not use, actually, I think the number is 5.4 million of CRF that what the governor made available. And so one of the things that are being talked about, and there's a whole different discussion, which I think this committee hasn't yet had, is what is being done with the CRF in the House. And I know that one of the things that have been discussed in the Economic Development Committee and the Education Committee is a concern about private colleges. And I think that I think that money may be where that's destined, but yes, it does create capacity.
Stephen, also within the administration's proposal for CRF money, there is absolutely zero money for pre-K through 12 education.
That's true. Yeah.
And so there's a demand for CRF dollars because nothing is going out in the current proposal to our public schools. And I think that the committee, and Chip, you have been in there, that the Education Committee is looking at to get our schools open and safe and to continue with the HVAC systems and, in making sure spaces are clean. They're looking at $35 million need that wasn't accommodated in the administration's budget.
What you're saying is don't get too excited about spending that. It could be
Right.
spent elsewhere.
I think that for CRF money, what committees are going to have to do are put their priorities in place if there's another stimulus from the federal government after we're gone that the GFC would roll out. Marty?
Thank you.
I just wanted to add to or comment on what Diane's remark and Steve's response to her, that what we're looking at now is a one-year bridge for the college system. And Steve says maybe, depending upon the ends of all of those studies that are going on, there may be another requirement for another bridge later on. But my presumption is that once we figure out how we're going to go forward in the future, the state colleges will probably ask for a higher standard appropriation in the future than they did in the past. In the past, it had been 30 million for several years now. And my guess is that in the future, it will be higher than that on an ongoing basis. And that's what we need to consider as time goes. But it's not just this one bridge and then we go back to 30 million a year. I don't think that's going to be the case.
I would say that Representative Feltus is correct.
Yeah.
And just to, I don't want to bore you with other thing. This is finding a solution was, Ledge Council, we talked about saying, why don't we say that we could take the $30 million of CRF money or take CRF money and consider that the state colleges aren't like the state. They could use their money to cover revenue loss or loss of tuition. But, and we talked to Ledge Council who actually thought that was a doable thing. They described the idea of using it for revenues as plausible. But the problem is that what we didn't want to do is put at risk I think the risk of doing that was higher than the risk of doing what we're doing with the state police and these are pretty legitimate in the guidance pieces. And this means that the state colleges will not, the state colleges will get general fund. They will not be at risk. They're getting this money in zero.
This is the lowest risk use of the CRF money that we've probably done throughout any of our CRF allocations.
Yeah.
Peter, did you have another question?
Yes, I did. So Steve, we in the Q1 budget allocated 7 million or 7.5 million in CRF funds of additional funding to the Vermont State College for their bridge funding, not for any identified expenses. Did that money go to them, or do we need to pull that back?
No.
That went to them, and they have actually been using using all the money you sent them on the way, and that's in that first slide, but they've used all the CRF money and allocated it to various CRF eligible activities. And they've done what they can, either to cover things that they need to just do or to cover things that can produce. If you go to the second slide in, you'll see that we gave them 7.5 million, another 12.5. 12.5 was primarily
12.5, yes.
Yeah.
Well, no,
that was
but
primarily,
12.5
for the testing and all the other activities like
Yes.
that. The 7.5 was part of the bridge, and
Correct.
they are already working hard to get that 7.5 to be bridge-like, to essentially use it for eligible activities that can help reduce costs. And they've done a pretty good job of that.
Okay.
That's the area where I went over all that they're spending on that. I think that there'll be some risk there, but most of it strikes me as pretty sound. And so they're not going to be risk-free, but there was no way we could give them more CRF and expect them to, with the current guidance, to give more CRF. And that's where the administration was right. There was no clear way to use more CRF under current guidance. And so that's why we really looked for a way to use the CRF somewhere else and give them the general fund.
Good,
Steve,
thank you.
just so the committee is clear, we did do the 5 million bridge in the Q1 budget, and then the total was 12.5. We did not give two amounts of 7.5 and 12.5. The total is the general fund and the 7.5 of CRF for a total bridge of 12.5.
Well, yes, for the bridge, but we also gave them other CRF money to function for the needs.
Right, other CRF, but for the bridge, it's a total of 12.
Correct. Just so
Thank you.
happens that the other CRF money looks remarkably like that. It was like 12 million.
Very similar, yeah.
15, very similar.
Yeah.
Okay, other questions from committee members? Steve was able to vet this with the health department, as heard, and I lost everybody. There we go. And as we heard, using public safety and Department of Health are really the green lights within CRF. And nobody likes to have any of this, meddled with in any way, even with promises that this is one time in this construct. But the 23.8 is a one-time construct, and then additional bridge funding, it will all be determined in January if that is what is needed. Other questions for Steve or clarification that is needed at this time? Are we thinking that this is a possible path forward?
Kitty, yes, I am. I think that what we
Yes.
need to hear is final, gulp, swallow hard. Vermont State Police, we're okay with it. And then, then we can formally vote on it. But I do think that this is viable.
Yeah. And
I'm with Peter. Kitty. I think Steve has done a great job, and you have in forwarding this, or whatever part you played in it. But anyways, thank you. Yeah, I think for this year, I agree totally with what Marty had to say. But for this year, it's good.
Mary.
Let me ask the question the other way around. Why would this not be a path forward? If it works, what is the downside of doing this?
Well, maybe I can answer that, because first of all, I actually think it does work, but the problem is nothing we're doing is going to be risk-free, and everything we do is going to affect some department in some way. And so the state police, as you all said, if the question, they are not, I can't imagine them loving it. It's not going to be a great thing for them. And I think you're going to find that there's anxiety with AHS, because, there's one thing about what we've done in this budget, and I'll try not to go too long, but I would say one of the things we're doing in the budget is you've been the most disciplined committee ever about base and one-time spending. And we know this is a year where we're really spending dramatically in with one-time money, last year's savings to cover things. So this is everybody's a little nervous about 22 because we're if I were to say the largest anxiety is just that we're creating a lot of state spending based on one-time sources. And I think everybody's nervous about when they have to face budget building for FY22 and the administration says, hey, last year we only gave you this much in base and now you need a 20% step up because of these things. That it creates a harder lift.
Can I say that?
So that means that we have to have the discipline, one, to restrain ourselves from spending too much of this sort of money this year. And secondly, for those of us who return and get to sit here, that we have to have the discipline to replace it.
Yeah.
So that puts it on our shoulders to be disciplined. I'm done. Thank
Absolutely.
you.
Bob?
Yeah, the problem, I've been sitting here thinking the awkward part of this is an election year. And who knows, maybe none of us will come back. I really doubt that, but we know a few of us aren't. Anyways, if there's some type of a mechanism that we can create.
Somebody has a phone ringing?
That thing is mine and
Oh, okay.
I can't shut it off.
It wouldn't be a
Sorry.
meeting without Bob's phone going off.
Anyways, if there's ever a I don't know how to fix that either. If there's ever a mechanism, I'll talk later. Thank you.
There you go, Bob. Any other final questions for Steve? I know he's busy and needs to,
Keep working, Steve. Keep going.
get back to his office. But he is in his office.
Squeeze every penny. Sorry, I guess I'm on live.
So
Great.
do we need to say yes to this now?
Oh,
do we need to think more or?
Well, I think that, everything that we do, we're shelving. And if the police come back and just say, we don't trust to be fully, made whole in January, it's a trust issue, but, there's a trust issue throughout every one of these budgets where we're using CRF.
And just one thing, the police could come back and say, we think the idea of using 68% of our general fund or 72% of our personal services is high. We'd feel more comfortable if you didn't use that much. And then the question is, do we find other cuts in government to cover the 23.8? Do we use reserves? I mean, there are other things, but those are all the choices you'll be left with.
We do have Adam here if he would like to weigh in, but I don't know, Adam, you're just hearing this proposal, so I don't know if you've had any chance to talk with the Department of Public Safety.
Thank you, Madam Chair. So our concerns, I think, are, shall we say, as advertised. I think you put your hand on it, both for the Department of Health and Public Safety. They will be staring at a fairly substantial hole starting next year. It is true, as has been said, that we have integrated somewhere between 15 and 20 million. I think your number was 18 million of CRF already into the budget, knowing that next year we would need to make that up, or it would simply rest as a base cut, which we did not intend. But the administration, I think, would like to noodle on this, so I don't feel like I can give you a strong opinion on it. Our concerns, in addition to the fact that it would be a dramatic change in base for public safety, would also be that it is a use of the fund. And it's true that we, as you have pointed out, have set aside $30 million, for example, for the state colleges and another 10 or 15 for other pursuits if additional flexibility is allowed. We did look at various structures like this and opted not to do that, in part because it distorts the base quite a bit. And there are reserves that are available, as the committee is certainly aware. So there are other ways of achieving the funding. But I think what I would say is that I'm sure the administration would like to consider this and come back with a more articulate response.
And I think we, Adam, and I think we have a couple of, I thought there were a couple of hands up that I don't see any hands up at this time. Any final thoughts for Chip?
Well, I'd ask Adam if he's willing. So you were in earlier, and we talked to you about our feeling that we wanted to make sure that cuts that you all were proposing and that we support largely were not cuts to the base, that next year we'd come back and people would start where they had been. And I was fairly reassured by your suggestion that that was your intent. I guess I'm just trying to understand how this is different. You know, you all will propose the funding for these entities next year, and so long as the revenue is there, or to the degree that the revenue is there, you all will establish the base essentially for those entities and propose that to the legislature to start with. So I guess I'm just wondering how or whether this is different in your view than the other reductions that you all said you were going to go back to starting with, you know, their existing base before the 3% cut.
So, and that's a fair question. I mean, it is a very similar construct. I would say the biggest difference is one of scale. I mean, just looking at the numbers, it looks like you're going to take 2/3 of their base amount in public safety for the first 2 quarters of this year, or in state police. That's a substantial number that would have to be made up next year. Now, it's true that the other coronavirus relief fund amounts that we've factored and clawed, but this really scale, not so much of a structure.
I'm not really looking at it as money that needs to be made up. We're making the swap now, but it should come in that that's the total amount. So I'm not looking at it that needs to be made up. If revenues are short next year, we're going to have to look at what the total amounts were across every board, whether there was CRF used as a swap in, you know, AHS or buildings and general services or wherever it was used. You know, we just can't say, oh, we use CRF money, you know, that's a natural reduction and we're going to level fund. And so I see that the budget is absolutely intact. We're just using different funding streams for 1 year with our intentions to go back to the original funding streams the next year. So I don't see it as a hole to fill. Because if we have to make reductions in budgets, whether we use CRF or we use general fund, those reductions will have to happen anyway. Based off where they, you know, what their spending was the year before.
And the more frequently you say that, Madam Chair, the more you will give comfort to our folks in public safety who are about to lose a substantial portion of their base funding.
I don't see it. They're not losing it. It's being swapped out for 1 year. We're making
For
them
1 year.
whole with the intention of, you know, that base funding returning next year. However, if there's reductions next year, it has nothing to do with the swap in CRF. It has to do with the fiscal landscape at the time.
Understood.
Chip?
Sorry, is my hand still up? I was.
Oh, yeah, sorry. Any final thoughts for anyone? I mean, that is my position that I'm taking, and I'm curious if that is a position of of members of the committee that we're looking at this as keeping public safety whole in this budget and not looking at this as a permanent reduction, that we're just using a different funding source for this 1 year, and any changes that may or may not happen next year would be based on fiscal reality and not saying, oh, any CRF money went out, you guys are all out of luck. That's not my intention here. I don't know about the rest of the committee.
May I say something?
Sure, Bob.
You know, I have to agree with you. The worst that happens is Vermont State College loses what they got this year. It goes back to state police, and that's it, the end of it. And Vermont State Colleges is going to be sitting there next year with the elimination of the money that they got this year. That's going to be a worry on our part, I think, but I don't see the difficulty. As long as we can make the, I would be in hopes that we can send that message to the legislature some way. So those that are in charge next year will get it, but who knows? But yeah.
Marty and Mary.
I agree with your assessment, Ketty, in that a budgeting next year will be based upon a forecast that we receive from the economists and presume, and we know they've already said it's going to be lower than in other years, not as low this year as it would be next year. However, we're going to look at the income that's coming in the door. We will disperse it as makes sense, and we will attempt to fund each department as well as we can based upon the income that we have. I think that means, backfilling what so-called now is CRF instead of base funding. I do like the current proposal in that it does maintain our rainy day reserves, so that indeed if income is too short next year and we have trouble making things match the expenditure that may be desired, we will have the rainy day funds to work with if we need to next year. That's why I don't want to use them this year.
And it may take the economy 2 years to build back up, and that the rainy days could be used as a bridge if the economy is building back up. Mary.
Yes.
So this is to my point that I made earlier. We just have to be disciplined to replace what we're taking away. I want to be clear that next year, when we are disciplined, we are not taking something away from the state colleges. This was a one-time funding. And yes, I understand Steve's point that they may need an additional bridge, but I don't want us to go into this with the assumption that this has suddenly become their base budget, this additional 23. So just to repeat what we're all saying, which is we've got to be disciplined going forward. It's a way to solve the problem this year. I think it's a great idea. Thank you, Steve.
Any final thoughts? Okay, I think that we will, do we want to take a straw poll, at least on this position, because it's not a straw poll, shelve it, because nothing gets closed in the budget until we vote it out. Are we ready just to take a straw, not a straw, but a shelving? Are we willing to shelve this proposal? Accept it and shelve it? Peter?
I would recommend that we do shelve it. I would also recommend that we show it as a different section, a 0.1 section instead of the exact number that Vermont State Colleges is, such that it is allocated as a one-time bridge fund, and it's clearly indicated as such.
So the individual changes would show in those individual budgets, but then the appropriation to the Vermont State College would be shown separately as a one-time bridge.
Correct.
Okay. Maria, did you catch all those pieces?
Yeah, and probably what
Yes.
we do is take the 5 million you've already given them and just change that number add the 23.8 to that, and that the one-time appropriation would be 28.8.
So it would be all in total. Thank you, Steve. Mary?
So I think I'm prepared to shelve it with the understanding that there's going to be some conversation, particularly with the state police who haven't seen this. And we need to understand what their concerns are.
Absolutely.
But let's do it.
Just so that everyone knows, it would be 602.2. They already have a 0.1.
Okay, you mean in the budget. Thank you, Peter. I
Correct.
was wondering where you were going with that. So those let's put it on the table. Those that are in favor of accepting the proposal and shelving it at this time, I'll raise a hand, please. Okay, and a verbal no if you disagree with the proposal. Okay, that takes a big chunk of our work away. We still have Kimberly, tomorrow you're hoping to have a whole package from the committee down the hall, the Human Services Committee.
Right. I have a couple pieces that I'll put in order tonight, and then they're meeting tomorrow for another key piece. And I think that's at 12:30. So there may be one late arriving afternoon piece.
Thank you. And Steve, we were hoping, there was some language that you and Maria were going to help us with. It was the very front language, A102.1. We like the language. We just want it subject to technical review or to financial reconciliation. And that was something we had asked the Joint Fiscal Office to help us with the proper wording. So if I know you're really busy and I'm not sure when you can possibly get us that.
Well, we've asked, if it's okay, we've asked Stephanie, and she's going over with Jen Carby over in Ledge Council, and they just want to be right with it. So I'm guessing by tomorrow we can give you a final version of that, but I just want to make sure we're handling it in the correct way. It's not I don't think there's any major changes. It's just sort of we just wanted to let them look it over.
And there's been lots of talk about what happens if CRF money comes in after we.
And so we're working on that. That's it's actually a really complex issue because there are three parts of it. There's what happens if money that we've appropriated no longer is needed for that purpose, and that's sort of the reallocation issue. The other is if changes of guidance happen, and the third one is if money comes in, like you said. And so in each of those cases, we're trying to work and get some language that would capture the process. And then there's also, and part of it, I think, is you had said earlier today, the legislature might want to provide some sort of guidance to the Joint Fiscal Committee if we make it joint fiscal of what you want us to do with that money. And I think the other thing is that the fallback is at the end of December, when we have our last few days, any extra money can be put into the UI fund, just because it's someplace you can put money into a fund right away without any six, and it can absorb every bit of money that you have spent putting UI benefits in. We have spent a lot. So that'll be our real fallback. But before that, there may be other things that people are considering that really have value. And the other problem with this, is that we're trying to make sure is we could decide today that there's a real problem with food. And then the next thing you know, you can get a relief bill from Washington that has more money on that issue than any other issue. And so you don't want to make, it's one thing to get guidance from the other committees on what areas are important, but you really have to have flexibility for this process to address the needs that come up. And we don't even know how the virus is going to appear. So the thinking of this provision, and we're working on it. I'm hoping we might have a draft by tomorrow at the end of the day, or maybe at the latest. Tomorrow's Wednesday, so we need to do it. Is to have it mirror somewhat what's going on now, where the administration would send out a proposal. It would be shared with all legislators, and then the Joint Fiscal Committee would vote to accept it. And there may be, but this is part of what you all have to consider. I've seen one draft. I've sent back corrections, and we're hoping to have a draft by tomorrow sometime.
Thank you, Steve.
Okay.
And Adam, if you could catch up with me later, in the language in section 282, there was a repeal that was put on the table. You repealed letter D, and now you've taken that repeal off the table, meaning it's in place. If you could catch up with me, because I need to go back to Ways and Means. That was something they had agreed to the repeal, but you've now taken that repeal off the table. It has to do with the tax.
That's the sunset, right?
I think that is.
Madam Chair, if I might say, it's section B 104. It starts on the bottom of page 16 and goes over to 17. But it's that little piece where it says
Oh, it's
repeal.
not part of D104. Oh, it is D104 in section 282.
Yep,
Okay.
that'll help Adam.
And
I'm
so-
happy to, yeah.
So you repealed the sunset, but it now is keeping the sunset in place?
Yes.
Okay. I just, I don't think Janet's committee, that it was a really small thing to see, and I think that they may have missed that.
Oh, really? Okay. Yeah,
Well,
I can, if you want, I can follow up with her.
Would you please, Adam? That would be helpful.
Absolutely.
Thank you. Thank you. Okay, I don't have any other pieces. We have a bunch of language coming in tomorrow, and we have some money pieces and some policy pieces, depending on what is decided to do with the childcare, whether we keep it with community partners or whether we go back to the central office of the state. And there is a cost to that. And Maria, the information that we all worked on yesterday, where we went through all those additional areas that we might like to see some funding. Maria is working on a chart. If we stopped interrupting her during the day, I bet she'd have it all done. There's a chart that shows where we are with all the bills combined into a budget. And then it will show the general fund, what money that we're spending, what we have agreed with the governor, what we have taken off, what additional things we would like to consider, and where we are on the bottom line. And you're close, Maria, and I think you'll be able to go over that in the Wednesday morning or Wednesday afternoon, which would be better for you. It may be better if you did it Wednesday afternoon.
Yeah, that's what I think.
Policy committee decisions.
Yeah, that's a good idea.
But it has a lot of moving pieces, and it should be really clear once we see it. It's taken some time to put all the pieces together.
Madam Chair, if I might, because we've been invited to go to on a field trip down to Ways and Means. Is that tomorrow morning?
That's Thursday morning at 8:30.
Oh, Thursday morning. Okay. I was hoping I'd give Maria more time while we were away.
Nope, it's Thursday morning. So I'm hoping to have as much from the policy committees. Are you guys good with spending 15 more minutes so we can walk through the very end of that language so that Chip and Peter and Marty can work on language proposals for us? There was just a small section left at the bottom of page 5 that we did not address, and
Are you talking about the bill or language?
No, I'm talking about the stimulus equity bill, because we have such a short amount of time in that bill around that if we can give them pieces to work on language, I think it would be really helpful. Teresa, could you put that bill up when you have a chance? And we did get an email. Did any of you happen to have a chance to read the email from Mike O'Grady? Did it answer our questions?
I did peruse it, but I'll tell you, he writes in a very succinct manner that I need to actually read it.
He did address the check issue. It said each state agency is assigned a day each week to submit approved grants to the treasurer for payment. Once the approved grant is sent to the treasurer, it generally takes a day to issue the check. So it may take between 1 to 7 days for a check to be issued for an approved grant. That answers our question about the checks. And then definition of a child. he did say there is a problem. If it's approved on a Wednesday morning, it will take 7 days for the check to be issued. I don't know why Wednesday morning makes a difference. Definition of a child. And I would want you to pull up your emails. I think Teresa sent it all out because it's a long email. Who has not attained age 17. That is in the economic impact payments according to the federal government, that the child tax credit defines qualifying child as follows. The term qualifying child means a qualifying child at the taxpayer who has not attained age 17. So 17 was left out, and then it says persons 17 years of age and persons who are 18 years old and dependents do not qualify for the CARES Act economic impact payment. So the federal government made a conscious decision to leave 17 and 18-year-olds that are dependents not to qualify. However, in the HEALS Act, if the second stimulus bill that was introduced in July ever passed, there was no age limit for dependents, but who knows where that will end up. So that answers both of our questions. And so I think if we could address those two pieces and then look at the end of the bill, it would get us a long way to moving this forward. So the first piece was the piece about the checks. So is the committee comfortable now that it's 1 to 7 days to get a check out from the state of Vermont? Are we, I think that's the question. Diane and Marty with the yes. Diane, your question or thought?
So, yeah, mine was, it seems, well, it could be long, but it's not impossibly long. I just think I think the thinking for me is like, if they go the route of a check, that might be the route, you know? I don't think we're mandating it. I think we had left the payment method up to them to do, well, Peter and Chip and Marty were working on a, you know, yeah. So it's just good to know if they went with a check route, that's the time frame.
So I think that the discussion around the committee, so that we don't go too far off in a different direction right now, was that if it was a short period of time, and I think it was under 10 days that I did hear, or with, you know, around a week, that we would accept that use from a check from the state of Vermont. Does anyone want to go back into that discussion? That's my
only because I thought that we had like had that nice long discussion and then we went, okay, let's just go with maybe in number 2, that leave it up to them, of procedures, requirements, guidelines, and those guys were working on it, and payment process.
So my question, no, that's not my question. Those guys are going to come up with a payment question. We said we would allow a state of Vermont check to be part of the process, or to be considered part of the process if a check came in under 10 days, a week to 10 days, and it does. Does anyone want to reverse that decision? Okay, so Chip and Marty and Peter, we will leave that there. And then let's go to the 17-year-old, where in our definition of an eligible child, we have 18 years of age. Are we comfortable with this, or do we want to follow the letter exactly to the federal provision? What are, we're going to take a vote one way or the other, but let's hear just a couple arguments and then we'll take a vote one way or the other. Chip?
Well, in general, I have been arguing for us to be following the federal program fairly closely. I would say, though, that on this particular issue, that makes no sense to me, and that we would be leaving out, you know, sort of intentionally and specifically a group, I don't know how large, but a group of Vermonters who I think we would have assumed would be eligible for this, and that we would want to provide the relief for. So I would say we stick with the language that we have here And I'll just add that both Nolan, I think, but certainly Susanna said that the fiscal note that we have takes into account what we have in the bill. So it would not, including these 18-year or 17-year-olds, would not increase the amount in the fiscal note at all.
Thank you, Chip. Any other thoughts on the language as we're seeing it and what might be proposed? I gotta just see. I have Linda.
Yeah. Yeah, I'm okay with this, the under 18, because that's what I was talking about before. You know, it could be 17 years, 11 months, you can get the money, but if once you hit that 18, you can't. So I'm okay with that because we are not using general fund, the state's money. So I'm okay with this.
Any other thoughts? Can we take a position? Are we ready to take a position on line 18, eligible child definition? I think we are, and we've heard two arguments to leave it the way it is and support any individual under 18 years of age meets the eligible child criteria. If you support that, can I have a full screen just for a minute, Teresa? If you support that, get ready to put a hands up, please. Okay, and if you're opposed, could I have a verbal no, please? Okay, so that takes care of another piece of language, Chip, when you talk to Mike. That's another piece that we can knock off. And then let's just go to the very end quickly. I think we were really close to being done. And I just want to give the committee who's working on, working on some language, if they, I just want to give them any direction. And if we don't cover it today, please feel free to reach out to them. Go up a little bit higher, Maria, because Teresa, I think we hadn't quite finished this page. Protections, you guys want to read this through with me. And okay, the top part was about the protection of personally identifiable information. And I think Mike covered that pretty well. And it brings it down to 1, 2, and 3, which all has to do with protecting someone's identification. Did anyone feel that there were any changes needed in there? Mike said basically it's covered unless you have a bad actor, and it's, you can't stop a bad actor from doing deeds except after the fact. Okay, then let's go to section 2. This was the money, and we had tentatively put in $5 million, and Chip is still vetting the CHINS money from the Judiciary Committee, and I have not heard back from the Human Services Committee yet. And then the other was if they were to contract out for any kind of services help, that we cap the fund. Are we all in agreement that we would cap the administrative costs? Is it actually, let me put it this way.
Yes.
Is there anyone opposed to capping the administrative costs? Okay, and if we're not opposed, what number would you feel would be a reasonable number, or would you like to leave that up to the working committee to find out what other cap costs are for administrative fees? Any thoughts on that numbers?
I think we ought to leave it up to the committee of purview to kind of figure it out, Madam Chair.
The work group of 3, and if anyone wants to weigh in, and we could certainly weigh in when a proposal comes back to us.
Right.
Is that good with everyone, to leave it to the group and we all can reach out and give our 2 cents or 3 cents? Okay, then that brings us to the bottom of the language. And so good luck, Marty and Chip and Peter, working with Mike and working with Susanna. I think it's outlined pretty well. It's just that you have a couple of chunks that really need to get solidified. Questions from those 3 to any of us? Did Chip and Marty and Peter have any questions for us about expectations, or you're pretty clear what you need to do? Okay, I think we're in tremendous. I think we're in really good shape. You guys are just, I keep giving you more work to do. And don't forget your CRF funding. If you have thoughts on CRF funding, reach out to your committees of jurisdiction. We're going to get letters tomorrow afternoon. Diane, you got to figure out that meals thing with Meals on Wheels versus other meals, okay? Make sure that's really clear.
Totally did, and you'll see the email that I sent to Monica. I finally got to the bottom of it.
Excellent, okay, excellent. And Peter, don't forget the committee is going to address the recovery centers. Okay?
Hey, Kitty?
Yes.
So I had thought, maybe mistakenly, that the CRF memos or whatever, the recommendations from the committees were due Thursday, that the general fund or the other money, I've been telling them tomorrow at the latest. Am I wrong about that?
Well, let me look. I think that we sent some out. I think we sent some out. Mitzi and I worked on some letters last night to those committees. Boy, I haven't looked at my emails for a while. And
Tell me about it.
if I can pull one up, and I think it says, that they need to start working on them. But I can't find one because I have too many emails. Let's see. Can you get language drafted? We've met. Well, it's going to be Wednesday or Thursday. We'll take them Wednesday or Thursday whenever we get them.
I just know that the Ed committee is going to take more testimony and is going to get theirs to us on Thursday. The other non-CRF memo has already started to come in from them.
So Linda, you have a lot with Mike. I know that there's some housing pieces, Dave, that you'll get. Chip has some education pieces. There may be, Marty has a piece of language that's coming into to change within an existing appropriation. And I don't know which other ones are being worked on, but.
What, Bob's, I hope he's still here. Now that we've made this little, at least shift in the transportation piece, that communication to the vice chair and their committee to know that that's potential, it's back on again for them.
Bob and I met with the vice chair at noon.
Okay.
We didn't walk through the whole proposal.
Okay.
We told her that there was a proposal on the table and that I'll let her know that we have shelved it and that it's a plan that we would like to move forward with.
Okay. Just checking. Thanks.
Thank
Kitty,
you.
Kitty, Ted and Joan are going to be at Commerce tomorrow morning at 10:30. I'm going to jump out to see what the talk is. But then the next morning, Thursday morning, when they're talking about actually writing the document. So I will also jump out at that point in time.
Yep, good idea. Thank you, Linda. I can't thank you guys enough. We're really in terrific shape and you're just doing incredible work and I'm really appreciative. And so thank you. And we have some little loose ends to figure to sew up and we have a bill to agree upon some final language. And it looks like Friday, maybe it won't be a really late day.
Hey, Kitty.
Maybe it will.
Don't
Kitty?
ever say that out loud.
By the way, I have a birthday party, not for me, here on Thursday evening. My daughter's coming in from Boston. So I mean, it's just going to be a matter of dinner, etc. with my kids. So
Are you cooking?
Yeah. Something easy that they all love and they want, and they've already said it, and it's a slap. So
Yeah.
I just will not be here much beyond 6 o'clock. So
We should be done before that. And Teresa, I think we can go off live because I think we've finished.
Mary needs you.